So hang on, you lot are cousins? Like, what's your relation?
We're not blood cousins, but we grew up.
Oh, like family friends like that. Yeah.
Basically, my actual cousin that I used to live with in Elephant and Castle. I don't know if you met him. Oscar, the old guy who's on crutches.
No, I ain't met him.
But yeah, he's my actual cousin. But her mum is his cousin, but on his dad's side, and he's related to me on his mum's side.
Oh, I understand. So it's not blood, but it's like my family kind of thing.
Yeah.
We are, yeah.
How old are you?
Together. 31.
Okay, cool. So you lot are like similar ages, like, makes sense.
Yeah, man. So yeah, man. This is literally the gaff. It's literally just this room, my room, the kitchen, and
How long you lived there then?
me since last year August.
Bro, I've been around Tooting best. I used to play football around here.
Is it?
Not Tooting Beck.
Yeah.
Bro.
I play for him right now.
No, but you probably play for Tooting Beck like team.
Okay.
I was just playing on the pitch.
Okay.
I played left wing, bro. But that's what I used to come here every week, yeah, bro. There's one bus, is it 155, 133? It goes from Elephant and it takes long.
134.
Yeah, 133.
I don't know.
Oh no, 155, 155.
When I was older, yeah, I just realised, bro, we could have just got tube this whole time. Why was we doing this? Like,
It's true still.
like we're literally on the thing for an hour and a half, one way and back, like, just to go ball. Like, it's just mad, bro.
That's hilarious. That's jokes. Hey, but yeah, do you know what we're gonna talk about today?
What do you do? I know, you know, fam.
That's what we're talking about. You see, you work in a GP right now, yeah?
Yeah.
And you study medicine, yeah? Did you specialize in anything?
Nah. So what happens is when you graduate, you do 2 years, you go around everywhere. They send you to different places 4 months at a time. So that's what you're meant to basically use to, like, say what you want to do with your career.
What did you want to do?
No, I want to be a GP, innit, basically.
You don't want to go and specialize and become like a doctor or anything.
Do you know what's so funny, bro? Like, this is actually so funny. I'll just say my interest in it because low key, yeah, I had bare interviews for jobs and I told them different stories.
Okay.
I don't know which one's gonna accept me, bro. But nah.
What's the chances that they watch this though?
No, but I'll just say my interest. Like, I'll just say what I said to them. Like, obviously, I'm not gassing it, but bro, basically, long story short, yeah, like, I wanted to be a GP from the beginning. I've never been sick like that. So for me, like,
You've never been sick like that.
To be like in a hospital,
Right? Okay.
So I've never been in a hospital myself to be like, I barely appreciate what you man do because
Right.
I've not seen it. My
but
family,
you've been in one though.
yeah, no, but I'm saying like before I even went to medical school.
Oh, okay.
Like, so going into medical school before I had any experience, like, yeah, I just want to be a GP. Like, this seems calm.
Right.
Obviously, like, everyone has an older family that go to the hospital. My family don't live in this country, so I also ain't been in the hospital with them.
Okay.
So that never pulled me. Do you know what I mean? So I wanted to work in a GP. I just wanted to have my own kind of clinic, just start my own clinic, like live my life kind of thing. Obviously, it's like you're doing your job, but it's also a business. So you can improve your thing. You can like kind of scale and that.
Yeah.
I like that aspect of it. When I went for medical school, there were some other things that were like mad interesting to me. You know, when you're having a surgery, there's a guy push you to sleep.
Yeah.
That was mad interesting to me.
That in itself is like, he's a separate doctor for that.
Yeah, bro. So that's like another thing, sort of anesthesia. I bear like that. But then what I didn't like about it is like, you know, in GP you come like, what's the problem? I solved the problem. In this thing, there was no sort of that because you can see it from yesterday. Someone's coming for this surgery tomorrow. You read through their notes. Then you think, how am I going to administer this? What drugs am I going to use? Yeah. So it took away like the diagnostic challenge. There's none of that, right? Because, bro, I just know there's 5 ways of doing this. I just got to make sure I do it the right way for you. But we're not answering any questions here. Everything is known. Do you know what I'm saying? They've done the scan. We see the problem. They know what surgery they're doing. So I didn't really like it. But then I worked in intensive care. And intensive care is like, bro, like people that basically get written off by cars, yeah, and they bring them on a helipad and like, we save them in it. So I worked there, but that's kind of like a cross between like the diagnosis kind of part and also like the interventions in it. So a lot of the things that they do in anesthesia, like putting them to sleep, putting in the airways, it was there. Like the practical skills were there. So I proper like that. The only thing about that was, I'm not sure if I can, even I'm interested now, I'm not sure if I'm 45, I still like to do something so high tempo. Yeah. So I was in 2 minds in it. So those are my interests, and I just kind of said like, I'll just apply and like wherever I see in the interviews, like if they like me, if I like them, whoever makes me the sort of like best offer, like I'll just go in it. But either way, I was happy with either of them, innit?
What do you mean by intervention, by the way?
Interventions, so like I just mean like actually physically doing things. Because you know, if you go to GP, if you come to me like your legs hanging off, I will not actually do much. I'll tell you to go to A&E. Whereas like there, it's like, think about when I was talking about diagnosis, you'll go, like say you get run over by a car, everyone knows that's the problem, but what's the medical problem? Do you have internal bleeding, this, that, like we need to do a scan, look into it, and then obviously examination, you find the signs. Now you feel like, do you know what, this was mad hard to find, but I found it. You feel some sort of like, if another doctor saw this, maybe he wouldn't have clocked it, but I've clocked it, I've made a difference.
Right.
Do you understand? Whereas essentially on the other side, if like in anesthesia, don't get me wrong, they have those acute situations as well. But obviously, for my level, they wasn't putting me to go be in charge of emergencies.
Yeah.
I was just doing the
General
like in the surgery. I was just putting the tubes in, which obviously is complex, but it's in a controlled environment. If I can't do it, when the person goes to sleep, we have like 5-8 minutes to like sort it out. So if I flop twice, the big boy will just come and do it.
Right.
Like it's in a controlled environment. Do you know what I mean? But it's just them ones there where it's
Did you ever flop?
yeah, of course I didn't get everyone. Bro, it's like at the beginning, bro, this is a mad skill. So let me put it this way. In medical school in England, yeah, I had like I did anesthesia as well, obviously during medical school. There's 3 different ways you can put the tube in. It depends what kind of surgery they have here. One is just like you could put it in, bro, you just push it.
Right.
It's not deep. The other one, you need to use a scope, yeah, and look and put it in the right place, inflate the cuff. That one is the
General anesthesia is.
put people to sleep.
And what's local anesthesia?
It's just like numbing someone, yeah. Bro, so it's them ones there. When you put in the one with the scope, you need there's skill involved. There's 2 tubes here. One goes to your lungs, one goes to your stomach. If I put it to like the one in the stomach here, all the air we're pumping is not going anywhere. It's going to your stomach. You're not breathing.
Right.
So you can it's easy to make a mistake. Some people's anatomy is mad. Some people are like, let me just say, of a larger body habitus. Do you know what I mean? Like it's hard to do. So in medical school, I only ever tried the one where you push it in.
Yeah.
But when I went on my elective to America, they just said, no, you're going to do the serious one from the first day. So obviously, no one's expecting you to be good on the first day. Of course, like, when you said how I like got it wrong, yeah, but no one expects me to get it right.
Right.
I was there for a month to like...
They kind of understand that, right, it's a process. Like, you're going to get things wrong.
The man's been doing it for 5 years.
Yeah.
That's why he could do it right every time. Like, I'm here, I've never done one before, I'm here for 4 weeks. By the end of the 4 weeks, you'd hope I get half of them right. But I did better than that, but that was not expected by them. They were impressed by my performance. It's not like they said, yeah, standard. They were like, nah, like you're getting it kind of thing, innit?
That's crazy still. That's crazy. What was your experience in America like? Because you went medical school here.
Yeah.
Did you go to medical school anywhere else abroad?
No. So I went to medical school at King's College, bro. So obviously, it's a 5-year course, but I did 6 years. Essentially, there was like a kind of like a scheme here. If you went to like a public school, because these things are heavily influenced by like, or heavily taken up by people that go to private school, right? So I'll tell you now, when I went to uni, the people I was meeting,
just placements in general for medicine.
yeah, bro. Like most of the places go to like private school kids because they put them in the best stead. Like it's mad, bro. Like you know, like obviously you went to Cola, bro. You know, if you think about who got like good grades, some people got good grades, but us men all know each other to the point of we still know each other. Do you know what I'm saying? But like you'll be the minority, bro. Whereas there, like, there's girls that are telling me they got 3 A's, yeah, and this is like the worst grade in like the history of their school or something. Like they've done terrible compared to their friends, yeah. Like, bro, but this is the thing. So when I went there and I started deeping like how much help they had compared to myself, bro, there were people that like told me they went to a boarding private school and it was 40 grand a year, bro. And they did this for the whole, like, forget college. They did this from like 5 years old to 18. Obviously,
so
I guess
young.
Primary school, it wasn't 40 grand probably. It's not that serious of a school. But I'm saying you're paying them kind of fees, yeah. Deep it this way. When I went to uni, I was thinking, bro, I'm paying 9 grand. This is mad. They're looking at it like this is 75% off.
Yeah.
Do you know what I'm saying? So, bro, so obviously, like, I don't even know how we got onto that, but I went to medical school, obviously, in England, and you get 2 months to basically explore anything that interested you through the 5 years. It's kind of like to give you a kind of
a general overview of everything.
Not really, like you get a general overview in medical school. This is like if there's something you like, you want to pursue it as a career, you can spend 2 months doing that alone. So now when you go into work, before you even do them 2 years, you can kind of like, no, this is the bottom going down. There might be some exams you might have to do. There might be some conferences they're doing. You can have like an interest in it. And because like there's a lot of things that are niche, like I'd say dermatology is quite niche. In medical school, you're not spending loads of time in dermatology. Like radiology, people that read scans. That's like a specialist area. This is the man that's reading the scan to see if you have cancer or not. What is a medical school student going to do there apart from observe him doing that?
Yeah,
it's never going to be in your hands, bro. Things like that, like if you're interested in stuff like that, you can use that 2 months. Just go and do that fully, see if you like it. Because in medical school, you've done the minimum hours you need to do in that, but it's not something where you spend bare time in it. Do you know what I'm saying? So during that time, you could do it in any geographic location, any speciality. So so I decided to go to America, innit? And I went to Mayo Clinic. So I was there for like 8 weeks. I did anesthesia and I did GP essentially. So I just wanted to see what both of them look like, innit?
What was the difference between how it's done in America and how it's done here?
But how it was done?
Like conducting just general application of all your knowledge, pretty much. So as in like just the day-to-day workings of everything. So like a GP here and a GP in America, what's the main difference? Anesthesia here when you apply it.
No, GP. So I work in GP now instead as part of them rotations. I work in GP now. So what I'd say is different essentially is obviously every clinic is different. The same way there it's different between each other. Here it's different between all the ones here. But what I'd say is different is like, say for example, I see you and then like I see some concerning symptoms and I want to send you to a specialist. But how many people have I sent? Yeah, and they're like they have pain and like I look on the thing that says next available appointment and it's like 120 days. But in America, they will just send you on a day, bro. But it's because of the resources. It's private, innit? They have resources. Same way here in England. If you're ready to pay, you can go and see someone probably next week. But obviously, because it's a public health, well, in economics, you already know, man. Anything that's like free is overused. It's undervalued. So people come with like problems that they didn't really need to come with, or they don't really, or they miss their appointment because they're not getting fined for missing it. There's no cost to them, so it just backlogs everything. So what I'd say, I guess what we're talking about is private versus public. Public is probably better for like the general public, people that maybe can't afford healthcare, have access to some sort of healthcare. But then again, someone that, I don't know, if you're like Elon Musk and they're telling you to wait 4 months, you're better off paying £200 again tomorrow.
Yeah, it's true.
So it's just, there's no system that can help everyone, but it's both of them have their pros and cons.
What system do you think was the best though, public or private?
I don't know, bro. It's got like their own.
Or do you think how the UK have it, where it's public system for everyone? If you can afford it, you can go private. That's the best way to do it.
Bro, I don't know. Like it's them ones there where it's Can I be honest? You know, if someone had the answer to this, the world would be a better place. Like I don't really know, but I said they all got their pros and cons, yeah. But one thing I'd say, before I went to America, I was proper like, nah, public healthcare, like everyone like should have healthcare. Like, I don't really believe in like stopping people from having healthcare. But when I went to go see it, I realized the fear mongering that they make, like in this country, like regarding that, they're just fear mongering it because they don't want it to change here. Like, it's not actually factual what's happening there.
But doesn't it impact a lot of people's health in America? So like, ain't there a lot of people in America that can't afford healthcare, therefore can't go to like the hospitals or GP appointments and this and that, the next, and they miss out on that vital healthcare though?
No, so what I'd say is, obviously, bro, I was only there for a short time, kind of thing, and I don't know, like, even the politics in this country, I don't understand fully. But from when I was asking them kind of questions, I was saying, bro, like, say for example, something happens and the ambulance comes, no one asks you if you have insurance. They just take you to the thing. If you have insurance, it gets cleared. If you ain't got insurance, they'll send you a hefty bill. You're not gonna die regardless.
Yeah, but then after that, you got a hefty bill on top of your head for it.
Yeah, but it's not like it's kind of like student finance. It's not like they're expecting you to pay it. They just want you to, like, so they was telling me, for example, some people say they bill you, I don't know, I'm just gonna use an arbitrary number here. Say they bill you for $250,000. But if you just say I'm gonna pay like £100 every month, like they'll probably just leave you in it. It don't go towards your credit. It don't affect your credit. They just like want you to pay some of it. Do you know what I'm trying to say?
I don't know if I could live with that though, bro. What, just because I get ill, go to hospital, break a leg or whatever, and I can't afford to, I don't know, I don't have insurance, can't afford it, therefore I've got to pay £100.
But you know, it's a different thing. I'd say it's a different thing, yeah. Like, it's weird, bro, because you feel like now you're not paying for insurance, right? But you're paying tax, bro, and your tax is basically your insurance you're paying already. Cool. But when you pay income tax, when you pay NI, you don't really know where the money's going. It might not even be going on stuff that's benefiting you. Yeah. So I'm saying, like,
most of the time I don't do.
I'm not the government. I don't know. Yeah. Like, but bro, put it this way: if the money's going to places, yeah, that benefits everyone. You're not everyone in it. So basically, 90% of it probably ain't benefiting you. But obviously, tax is something that everyone has to pay, so you pay in it. But what I'm saying is, like, put it this way: say for example, like, I don't know, say you paid 20 grand in tax this year, yeah, and like 5k went to like NHS, yeah. Bro, if someone gave you like health insurance for a year that was like 4k, that's in your benefit, bro.
Yeah, it's true. So,
do you know what I'm trying to say? So, like, what I'm saying is, I saw it one way because of obviously we're in England. They teach us one thing. Like, everyone says their ideal. Obviously, I went to medical school. Everyone shares their opinion. They present it as if it's a fact. Like, this is how it must be. Whatever. But one thing that kind of opened my eyes, it was funny. Something that a patient said to me. I don't even know if he's right, but like what he said is you can't factually contest. I was in America, and obviously England, public healthcare. Yeah. Canada, mainly public healthcare. There was a patient who was doing a surgery for. They were from Canada. They flew from Canada to America to have this treatment. And the guy was like, the doctor that was there was like, it's funny because you guys kill us for our private healthcare, but here's someone that wants to come and work here, and here's someone that wants to get treatment here. So if you lot think it's so great, how are you lot meeting here? And I was like, bro, I can't even lie. Like, we never had them convos before. He just said it outrightly because he probably felt like people in the news are coming for him. But I was just like, I'm not gonna comment, but I can't say nothing. You know what I mean? Because I'm saying, like, I'll get paid more working here. And these people are saying that, like, in Canada, they got to wait for 6 months. I can just come here on the day. So, can I really say which one's better? Like, essentially, what can I say? If you got bread, one is better than the other one. If you don't have bread, the other one's better for the other one.
It's relative to you.
So, it depends who you are. It depends who you are. I can't tell you what's best for you. You have to think for yourself.
That's hilarious.
You know what I'm saying?
Funny, fam. So, this is something that I want to know, but I don't really know much of, is like the reason for why doctors and NHS staff go on strikes and stuff like that in this country. Why? you've been in the NHS for a short while, wasn't it?
Essentially, bro, like,
Yeah, what's the reason behind
can I be so honest? When this was happening, I was doing exams and that. I wasn't really too focused. Obviously, I didn't come to work here, but it wasn't like I was outside striking. I was just revising my exams, yeah. But, bro, long story short, yeah, like, the issue is that, like, their pay just ain't increased since, like, 2008. You know, inflation's going up every year.
Yeah.
So, obviously, when you attribute all of that, yeah, like, house price going up, rent price going up, but we're getting paid exactly the same money, like, as people in 2008, then, obviously, you're relatively poorer. So, that's one of the issues. The other issues were about, like, they need more doctors, so they make more medical schools. But then see the point I'm at now, where you do the 2 years and then you apply for your speciality.
Yeah.
There's a limited amount of numbers, and the numbers aren't enough. But it costs the government money to fund more positions, like training positions, right? But they ain't really made enough. So what happens now is, put it this way: there's different specialities. Everyone does one exam. Mostly, there's different exams, but just generally speaking, there's an exam you do. And essentially, you have to be in like the top, like say 30-40% to even get interviewed for the job, right? But deep it, out of 100% of doctors, everyone is past medical school, everyone is competent, everyone is working. So why is it only like the top 30 that's going to progress?
Right.
And then every year, the same thing will happen. So it's like a bottleneck, right?
Yeah.
So like people, like I don't know the numbers because I never applied, but people at work talking about like, it's like 1 to 11, 1 to 7. So like out of the applicants, like for every, say 7 applicants, 1 will get the job. And then every year you got to go do that round. So they complain about the structure of the training and they complain about the money. Yeah, which is fair enough, bro. Like, I agree, because think about it, in 2008, like, what could you have got for a 5 and what can you get now?
Yeah, it's true still.
So if you're getting paid, like, the same money, it basically means that they paid them a lot more back in the day. Obviously, it should probably rise with inflation.
Yeah, now they get paid less pretty much.
But yeah, I don't know, man. I'll be honest. I'm not that versed, and I'm just telling you the surface. Like,
do you think, on your own personal opinion, yeah, if there was more positions available and open to people to go and specialize, there would more people would be open to doing it? I'm assuming too, yeah, that a lot of people don't even bother specializing because they know how hard it is to get a position, so they just kind of leave it. They're just like, cool, I've done my 5-6 years, I'm alright, just kind of doing, I don't know, being a nurse or like working in a GP or whatever it is, and that's why they don't specialize. But do you think if they had more positions, your own opinion, more people would go in and do it?
No, so this is what I'd say, like, some people, maybe like you went to medical school late or something, or you have kids, or some people might give up and they might go for something, say you want to be a surgeon. So this is the thing, it's not about what's better and what's worse. Have you ever had a surgery?
No.
Have you ever been to the GP?
Yeah.
So evidently we need more GPs than surgeons. Just because not everyone's going to go have a surgery, right? But just because of that maths, just because of that maths, there might be like 500 positions for surgery, but there'll be 4,000 for GP. Just because of the numbers.
Yeah,
you know what I'm trying to say? So someone that might going for like the one that's got 500, they might say, do you know what, like, I give up, I'm going to go for like GP or internal medicine because there's more places. Just because there's like sort of, just more places. We need more of those doctors in a sense, innit? That happens, but I would say everyone that graduates is a doctor, so you couldn't be a nurse, but you'd just be a doctor, but you'd just be working as like, you wouldn't have career progression. You'd just be working at like, see the level I'm working at now.
Yeah.
If I wanted to, I can just work at this level for the rest of my life. But like, it's not really my benefit because realistically, you could fill like rotor gaps and get like loads of money, but at the end of the day, everyone kind of like went into medicine saying I want to be a this or I want to be a that. No one wanted to like stop halfway.
Yeah.
So what I'd say is, if they increase the positions, yeah, people like would go for it, because what happens actually is, you'll do the exam, you'll get an interview, and after the interview, you get an outcome. And the outcome would say, are you appointable? So basically, are you good enough for the job? And 2, have you been appointed? Loads of people get you're appointable, but they'll just people better than you. So say, for example, there's 1,000 places and like 1.5k people. Yeah, man, you're calm. Like your knowledge is good. You're good enough to be here. But because we have a limited amount of numbers, we can't take you. So essentially, that kind of answers your questions with, will more people do it? Probably, yeah, because people are doing it now and not getting in. But the thing is, I'm not even saying it in a sense of like they should make a concession and let these people in because they're good. I'm saying like at the top, we don't have enough doctors. Like that's the main, we don't have enough specialists. That's the problem. But then you can't just make the juniors through medical school and then not progress them because you don't really have like, bro, put it this way, say you had a football team, you need a keeper and you bring bare people into the academy and then loads of them want to play and goal. But like you've only got one goalkeeping coach. You're not solving your problem because you're not getting the end result. You're just getting loads of guys that can do things to help that person. You might put a stronger defense or something, but your actual problem, you're not solving it because you need more specialists. You bring people in, then halfway you kind of drop them. You don't give them the opportunity. So it's not even a thing of us saying, "Oh, please, let us come." It's
but
like,
that means
we need this.
Like, it sounds like sounds like right now, like you say, that they currently do need more specialists, and what specialists don't really have time to go out of their way to help people
What do you mean?
come up to that level. Because the analogy you use, the goalkeeper and the goalkeeper coach,
Yeah.
if you still got one coach and you got like 100 more applicants that
Yeah.
come and be a goalkeeper, yeah, chances are the coach ain't gonna have enough time to look at all 100,
Yeah.
train up all 100.
But I don't even mean that by time. I just mean like I kind of use the goalkeeper coaches as slots, right? The guy can only come and train so many people.
Yeah.
So there's no point in them signing up 100.
Yeah, that's what I'm trying to say. Yeah, that's what I'm trying to say still.
So what they need is more basically positions to train to become a specialist. And by specialist, I mean like a GP, a surgeon, like you know a doctor that has a name. Like for example, I'm a doctor, right? Like my like title is like foundation doctor. So you do 2 years of foundation, then you go to speciality training, which is what I'm talking about. So whether that be a GP, whether that be a cardiologist, whether that be a surgeon, just like a doctor with them kind of titles that we know in like sort of like common life, that's the goal for everyone. Like everyone wants to be a specialist because that's how you kind of finish your training, and then you're the one in charge of making them kind of decisions. So the thing is, if they can't have enough people, they don't have enough training places, not everyone can make it, even though the need for them is there.
Yeah.
And the people that they need are there and they're good enough. The system is not allowing them to progress.
Yeah,
Do you understand?
Yeah, I hear it.
That's the problem, innit? That's what they're basically striking for in a sense. But then obviously other things with money come into it. But this is like
just the general.
the money, and then this is it's the money and like the career progression.
Are you allowed to speak about like let's say for example the whole system behind teaching doctors how to become doctors, whether you think there's areas that they're missing, areas that I don't know.
I'm not the best person to answer that because I'm not like. What do you mean medical school?
Just in
What do you
general,
mean, like, the
yeah.
training
So
after
that, I had another question that I wanted to ask, and I had another like just think topic that I wanted to discuss you about. Yeah. Before I even get there, obviously I need to know a lot more about like just general day to day and the things that you do and all that sort of stuff, because it paints a clearer picture of maybe like processes that go behind helping people with their health, and like whether there's like, for example, yeah, as a GP, I'm assuming you only ever focus on the symptoms that they're progressing and finding a cure for it, or like finding some sort of treatment for it. But recently I was reading a book from this doctor called Gabor Mate. I don't know if you're familiar with his work. He's more of like a psychologist rather than a doctor though.
Okay.
But he heavily argues about how a lot of the systems of how medicine and health is done and treated tends to neglect the fact that, for example, mental health, physical health, and emotional health all go hand in hand. But when you go to like a hospital or like a GP or something like that for your physical health, they always neglect these 2 areas of it, even though it has a lot to do with it. So when I'm talking about like structures in like medicine and health and all that sort of stuff, it's about like whether you think medicine needs to implement these 2 a lot more, which is the mental side and the emotional side, or do you feel like it's fine keeping it isolated to just physical?
No, I'll be honest, they do like have those things. Like loads of people are sent to like talking therapy, go see psychiatry. They talk to you about that kind of support systems. Some like what's it, Department of Work and Pensions. Like loads of people telling me they're stressed because they're out of a job. Obviously, you could just get them medication, but you'd rather solve their problem. Do you know what I mean? So I feel like was that book based on like UK?
No, it's he's Canadian, I think.
Yeah, it's probably based on Canada. I don't know what happens there. I'll be honest, like I say here, we have like a lot of things available. I'd say it would be nicer to have like more resources also.
But do you get educated on the importance of how much like mental health also affects your physical health whilst you're in medical school?
Yeah.
Like,
but then this is what's mad about it, because they taught us about that, but then I have no one to compare myself to. So say you bring someone else and he knows way more than me, or you bring someone else and he knows way less than me. I'm saying they taught me about it and I feel like I know about it. But do you really know how much you know unless it's someone that knows more than you? So I'd say yeah, but no, we had like loads of sessions on that, like loads of stuff.
Okay, right, yeah, that's just, I don't know.
It might be that how they do it out there. I'm not sure. Like
fairs, yeah, because it's interesting, isn't it? Because in this book, my man talks about how a lot of illnesses, stuff like cancer, stuff like autoimmune illnesses and stuff like that, they come from suppression, innit? And at first, you might be suppressing certain thoughts, emotions that like currently go through your like, don't know, in your day-to-day life. Could be things like not accepting, don't know, who you might be, for example. You might have done something bare stupid when you was a little kid. You might have done something bare stupid when you was a young teenager or adolescent. And like the fact that you're not able to accept these things and you suppress it so much, at first it creates like an emotional distress, and that's where stress comes from, innit? Right or wrong?
Yeah, like can.
Yeah, cool. And then the whole point of why you get emotional distress and like anxiety or any of these things based around all these things that you're neglecting and suppressing is kind of like a signal that your body gives you to basically tell you there's shit that you need to like focus on and work on and think about in it, just to like kind of get your life in order, life in check, and just like so mentally you're in a better place. But if you continue to neglect that, it starts to manifest in like a physical form. That's why you get cancer. That's why you get like autoimmune diseases, like I don't know, all these other things.
Well, can I ask you a question?
Go on. This is how I understand.
Yeah, no, I was gonna ask you.
I want to learn about.
No, I'm not telling you you're wrong. I'm just gonna ask you a question. I just want you to answer it for me, bro. So there's cancer that's genetic, yeah.
Yeah.
So what's to say that someone's not got a genetic cancer and they're saying all this?
It could be in it. It could be.
So no. So what I'm saying is, I'm not telling you that it is that, but you're not telling me it's not that. But I'm saying everything here is like, I'm just talking about for myself.
Everything here takes everything.
Everything he said, yeah, it could be true, but it could not be true. But these are also things that are subjective that you can't prove. So I'm saying like, maybe like what he's saying from his experience and stuff and how he's in Canada, maybe that's what he thinks needs to be implemented. But I'm just saying like, I'm not saying there's no one that didn't get ill because they're stressed. Of course. Do you know what I'm saying?
Yeah,
like,
yeah.
But I'm just saying that like generally, I'll give you an example. Like, my mum got COVID and like 3 weeks later, like she was having shooting pains in her arm, and she was telling me it's like a side effect of COVID, innit?
Right.
Done a scan, yeah, bro. She had a problem for time. It's just a coincidence. She would have had this problem whether she's got COVID or not. We can't make these things that like they cause each other. Do you know what I'm trying to say?
Yeah.
So I think even what he's saying, like, yeah, I think healthcare, you have to approach it holistically. There's loads of different things like the habits you have, the people you're friends with, the kind of environment you're in. Yeah, of course, I feel like it should be included. I feel like it is included at the moment.
Okay, cool.
But I'll just say like, obviously with like objective evidence of, I don't know, you smoked 50 years, now you have a smoking related cancer. You can't tell me that it's not because of smoking. But this stuff that he's saying, you couldn't sit here and tell me for a fact. You're just telling me what you think, which you may be right, you may be wrong. But like, sometimes you need objective fact to go forward. Do you know what I mean? So I'm not even saying he's wrong. I'm saying I don't know, because for the same reason, there's no objective fact behind it. But as a whole, would it benefit us to have holistic health? Yeah. Do I feel like it's implemented? Yeah. Would I say it's implemented enough? You can always do more.
Okay, I think he tries to take it down the route more of like trauma and stuff like that. He like just to show how like trauma can manifest in different ways, and it could be stress, could be anxiety, could be mental health disorders, but it can also be in a physical form if you don't do it.
Yeah, no. Of course, they talk about that. Obviously, the links between physical and mental health. Of course, obviously when you talk about those things, yeah. When you talk about things like cancer and stuff, that's a bit more far fetched. Not to say it's not possible, but it's a bit less likely. But of course, those things are definitely connected. Bro, I worked in psychiatry for once, so I can say like, yeah, I've seen that a lot. Do you know what I mean? Yeah. So
what's psychiatry like?
No, it's cool, innit?
What were some of the things that you had to deal with? Like, what were some of the things that you saw, that you learned? And what is psychiatry? Like, if you had
psychiatry is like medicine of the mind, innit?
Okay.
What would I say? It was broad, innit? You see, like maybe like younger kids or like teenagers with like eating disorders. That's a completely different thing than someone that has like psychotic disorder, like say schizophrenia. Like,
okay,
this is a completely different issue, but you're still in charge of both of them, innit? Saw people that like they had like something you mentioned, like childhood trauma, which led them to have like mental health problems later on, and obviously that's like a lot of like unpacking in that, because you'll talk to them and they'll come clean and it's like, I've been holding this in for 40 years, it's been eating me inside. So it's them ones there, like,
that's crazy.
Some people, for example, that they see things, yeah, like hallucinations, you can give them medication that can stop. But someone that's like, okay, so they see things and they know it's not real, but it's scaring them, you can give them medication and that'll stop. That is the issue. Whereas this person, say they're seeing things, but it's like because of the trauma they had in the past. Say like, I don't know, just for an example, like somebody robbed them 20 years ago, and they keep seeing that person.
Yeah.
That's a different thing. Do you know what I'm trying to say? Right. Because don't get me wrong, you can even give them medication, it'll probably stop, but they still have the fear of like, I might see him, because it's a real it's a real situation. Yeah. They fear a specific person. They're not telling you that they're seeing like dogs in a room and there's no dogs. That's not really scary. It's scary that you're seeing things, but you're not scared of that. But like, if you're seeing someone that like is, can I call them your enemy? Somebody that's harmed you. That's a different thing, innit? And yeah, so it's broad. Like, you see a lot of different things. So it's interesting still.
So when you talk about let's say, for example, the person that hallucinates because they got some sort of mental disorder and they see things that ain't really there and it scares them, and you can give them something for them to stop seeing that. Yeah. How much of the process are they then involved? Or because I'm assuming if they also stop taking that medicine, they'll just go back to seeing those things again.
No. So they don't really start like that. They kind of start with therapy, and it's called cognitive behavioral therapy.
Right.
So they'll send you to like go see a specialist. Obviously, this is like, I'll be honest, man. It was a while ago I worked. I'm not sure if they see like some sort of healthcare professional, or if they see a psychiatrist. I'm not really sure. to be fair, I was junior in a role, and my role was just to refer them to that.
That's
But yeah, they see someone, obviously they speak about it, like they get more insight, whatever. In psychiatry, like, bro, you go see a patient, you talk to them for like an hour, bro. Like it's proper, like in depth. You go like, bro, like honestly, I spend an hour talking to them, then I spend an hour writing a note, bro. Like just to let you know, like in GP, I'm seeing people in 20 minutes, so I'm talking to you and writing a note in 20 minutes. But now I'm spending 1 hour, like it's long, like they go in depth, innit? So, like, yeah, they go in depth, and then obviously they'll see what you need, kind of thing. Obviously, if you're on like immediate risk of like, I don't know, harming yourself, they might give you medication. But essentially, what you're trying to do is like deal with it, like cause, innit? So yeah, but then again, the only reason like I'd say there's like an issue, again, it's just resources, innit? Because if I'm talking to someone for an hour and there's only like say 4 of us in a team, work for 8 hours, have 1 hour lunch, so that's 7 times 4, 28. That's how much people can see
in a day.
But what 30 man come? Do you know what I'm trying to say? So like that's the only like issue with it. The way they approach it is good, but it's just that we just need more in it. But then again, if you want more psychiatrists, then now people aren't getting into psychiatry training. Then do you understand the whole problem?
Yeah, the whole issue. That's crazy, man. Damn. So what's your day to day like as a GP then?
No, I come to work like usually 9 o'clock. Just set up my room and that. Then yeah, they just allocate me patients, and then they just have a synopsis of what's wrong. Either I call them or they come in person, just examine them.
So you already have a rough idea of what you're going to talk to them about before they even come through the door?
Yeah, but sometimes it's wrong.
Oh.
Because like obviously it's the receptionists that like do it, right? And they're not medical doctors, right? So it could be like
receptionists.
It could be like, see, I don't know what training I have. Like I don't really see me. I go with someone, I do my role. Like I don't really ask too many questions.
You don't mingle about that when you go to.
No, I do. But I'm saying like I don't.
Like, as in socialize and get to know like everyone.
I do in it, but what I ask about is your life, not your job role. If you know what I'm trying to say, I'll talk to you like what do you like doing or whatever. I'll get to know you. I don't ask like, so like what training did you have to become a receptionist? I don't care. But I'm saying, for example, someone might say they have like stomach pain. Yeah, we'll say stomach pain. I'll say to them, yeah, it hurts. So like, what have you come in with? I'll just leave it open. I don't want to pigeonhole them and say, tell me about the stomach pain. Then they'll tell me in the end it's like a urinary tract infection. So risky, you're pissing, like it's stinging, and you have stomach pain. That's a different story than saying you have stomach pain alone. So you have to kind of, the synopsis, like it gives me like a window. As in, if you tell me you've got like hand pain, I don't think you came in for diarrhea. Do you know what I mean? Like, it doesn't necessarily mean I know what is wrong with your hand, innit? So yeah, so just a little synopsis. Then I'll just talk to them. Obviously, I'm not like a qualified GP. To become a qualified GP, you'd have to do what I'm doing now, then apply for like the GP training, like the specialist training.
So what's the difference between a qualified GP and what you're doing?
Essentially, this is what I'm gonna explain. So if you're a qualified GP, that takes like you finish medical school, you do 2 years of foundation, then you go into your specialty training. After that, you do specialty training, you're fully qualified, like you don't need no supervision, nothing in it. So the difference between how I work and how the GPs in the clinic work is I have a supervisor, who's been a GP for time, and like he's a GP trainer and stuff like that. So I see all the people from what, 9 to 12 or 9 to 11, 20 or something. I go downstairs and then we'll go through all the cases in it. If there's anything I missed or anything I messed up, I can just call them back and change it. So don't get me wrong, it's not like he's changing bare my plans. Most of these things like it's fine, but it's not like no one has checked this. Do you get what I'm trying to say? So that's how like it is, and that's basically how, if you enter GP training, it's 3 years. Yeah, that's how basically it would be for them years until you do the last kind of exam, and then now you're just like fully fledged.
So how long you got left till you get there?
Now obviously, bro, I've applied for different jobs, so I don't really. Well, 3 years. Well, 3 years. Yeah, 3 years basically.
Till you get to that point now, where you're a qualified GP. Yeah, but you've been doing GP for 2 years though.
No. So I finished in 2022. I took a year out. 2023, I started working. I worked in vascular surgery for 4 months. I worked in internal medicine for 4 months. I worked in an ICU for 4 months. I worked in psychiatry for 4 months. Now I'm working in GP for 4 months. So I've literally been here since December. Do you get what I'm trying to say?
So you're still in a process of like just doing bare different things.
Yeah. So you know when I said that specialty training stuff, my friends who graduated with me, because obviously I took a year out before I started working.
What did you do that year, by the way?
I was studying for like exams.
Oh, okay.
I just didn't want to do it while I was working, man. It was too long. Nothing that interesting, man. But, so them lot have applied now, innit, to start in August. Did you get it? Because they're like a year ahead of me kind of thing. So that's how I know about all these issues. They just complain to me like...
Yeah, they tell you.
Yeah, it's like, it's wild, innit? But yeah, so bro, like, obviously it's... like trust me, it's not... People think you just finished medical school and you're like in charge of the hospital and like, you can call me and I can admit you and I can do the surgery on you. Bro, there's way more people above you that's had loads of training. Like realistically, finishing medical school and going to the hospital, it's like... In medical school, you're in final year, you're like the smartest out of all the students, you know the most because you've been there for the longest. You start as a doctor, you're the stupidest person.
Again.
Usually.
Yeah.
Like, there's different people. Some people have like different degrees before medicine. Some people have like experience in another country before they start working. But essentially, like, you're expected to know the least because you've been there for the least amount of time, right?
Yeah.
You get some exceptional people, but it's not likely. Do you know what I mean?
Damn. So now that you've done all these different things, what area are you trying to go into then? You still want to go down a GP route, innit?
Yeah, bro. So something I'm interested in, like, I like dealing with people. I like diagnosis. I like procedures, innit? So I put it this way. Like, if you go through GP, you can go to like sports. That's something I'm interested in. Obviously, sports is like sports injuries, things like that. People that are going for surgery. You can do procedures like local anesthesia, and just those kind of things, innit? Dealing with like musculoskeletal injuries. That's something I like. Obviously, I mentioned before, like, I like the whole anesthesia thing. I like the ICU and stuff. Obviously, during like even like the trainings that I applied for, you go work in ICU for like 6 months and that. So I have exposure to that. So for me, it's kind of like open. As I said, I like talking to people. I feel like something I'm good at. It's funny, like, some of the patients like that I work with at GP now, they bear tell me they like me and like, they want to see me next time. But it's funny, I take it as a compliment. But I'll be honest, it doesn't really mean that much for my clinical
Yeah, obviously.
Bro, you can love me. I could be telling you the wrong thing, bro. You know what I'm saying? Like, but I like the like people interaction, and I like doing practical skills. So either like if I was to go down like ICU and whatever, or if I was to go to do sports, I'll be happy. But what I'll be leaning towards, of course, definitely like just doing like, it's funny because if you do internal medicine, which is what I'm talking about, which is kind of like ICU stuff and that, it's a part of it. You can still work in a clinic.
Yeah.
You're just not trained to see like women and children kind of thing.
Okay.
You can see everyone else. So essentially, whichever way I go, I can still do what I like, speaking to patients in the clinic, doing practical skills. So yeah, I'm going down the medicine route rather than the surgery route. So
decent. You ever had to fucking squat and cough?
What's that?
You know when people come into the GP with certain problems, you got to just do some crazy checkups. You ever had that yet?
Can I be honest, bro? Probably, but the way you're asking me, like, I don't even see it as I don't see it as like a mad examination.
Obviously not, because for you,
yes, I'm trying to think back here. Like, so when
for ordinary people, when did they ever have to tell someone squat and cough?
No, of course, bro.
Or bend over, like, let me have a look. Like.
But I'm just thinking, like, because I've gone to medical school, like, I've seen like mad stuff, like I've done mad stuff. I can't point to a day on this day I did this.
No, obviously not on
so
this
the answer's probably yes, bro. Like, it's like, do you know what I mean?
The first time when you dealt with stuff like that, there was stuff that was a bit like, for the ordinary person, a bit like, well, I don't know if I could do that or do that.
I'll tell you an example I remember. So when you start first year, you do anatomy. So anatomy of the body, right? Yeah. The way they teach anatomy at King's is by dissection. So literally, it will be a body of someone who's like donated their body.
Entire body already.
Yeah, right. the body of someone who's like donated their body to science. Yeah, that's what I still learn.
That's so fascinating.
And obviously, they've like, what's the word? I don't know what the word is. They preserve the body in like a chemical, so it doesn't obviously decay and that. And then literally, we learn anatomy, like how the body looks, what the organs are like, what's the relations to this to that. By just cutting it open.
That's
bro.
Crazy.
On the first day I went, I swear down, it was literally just. And it's the funniest thing I told you. Like, I went to like uni with like loads of these like sort of like a lot of people that went like to private school, they're from like affluent areas, and they went to grammar school. Basically, people that like they're doctors, all their friends are like doctors or bankers or what. They're in that kind of society, right? Yeah. So, bro, everyone's like just normal clothes they wear on a normal day, like they're wearing like polos and all that stuff. Bro, I came in a camouflage tech fleece, yeah, and like an Armani hat, yeah, and TNs, yeah. Bro, obviously back in 2016, that was the swag in it. So that's what I came with, yeah. And we literally got divided into groups. All it was on the first day, they just uncovered it, like they take off the cloth and you see the body. Bro, someone told me that like obviously it's like confidential, so all the windows are closed, the blinds are closed, because of that the room is hot, man. And obviously you can smell the chemicals. So bro, someone told me the day before, don't eat, because if you're scared, if you eat like breakfast, you might vomit. Yeah. Bro, so I didn't eat breakfast, I'm stupid. I never ate dinner the day before. So now I'm in there, I'm lightheaded, bro. And this they open the thing, and I'm just like, and then listen, they've said if anyone feels uncomfortable, you can go around the corner and just sit down, you can come back when you're ready. Yeah. I said, bro, I left. I'm the only person that left. I left, I sat down around the corner. Bro, I said to them I haven't eaten in it because someone wanted to eat. So they gave me glucose tablet, and water. Bro, you know like the glucose tablet, it's not, you know like,
is that the fizzy ones that
no, so that's the thing. That's the problem. Remember, it's my first week of medical school. I don't have any medical knowledge. So I've just seen the tablet that's round and it's orange and it smells orange. I'm thinking if I put it in, it's gonna fizz. Bro, it's not that. It's not the same thing. So that's the vitamin thing. The tablet is you're meant to just swallow it. But then listen to this, bro. I've put it in the water and I'm sitting around the corner. It's not fizzing. So these men think I'm rattled because I'm even not even taking the tablet correctly, bro. Like I'm like the corner, I rattled, yeah. Like this guy is so he don't even know how to swallow the tablet. He's trying to put it in the water, like. And I was just looking at him embarrassed, like, listen, no, it's not that, man. I just thought it was something. I had that whole minute, and then, bro, so I'm there with my tablet, my water. Yeah, they had to pull me a new water, fam.
No way.
And then it's just me, and it's just like I'm not even gonna say predominantly. I remember it clearly. It was literally just me and a few girls, and they were crying. I didn't know them. Like we became friends later, but based on that interaction, we became friends. But it was just them lot crying. I just felt like, nah, man. Like I need to go back there, bro.
You can't just be here.
I can't like. Basically, if not bare people around here, if it's just me and 3 people, and obviously like fair enough, like they feel emotional for whatever reason, that's fine. But I say like, nah, I need to be strong. Like I need to go back there. I've gone back there now. Like everyone's like, are you right? Sure you're right? I'm like, yeah, I'm calm. The next part was so they took off the cloth. Now they took off like the face cloth.
Right.
Now I'm like, oh, now it's become a person. But I've just said, no, I have to go back there. So I've just gone back there again, and everyone's like, you're back. I said, yeah. Like, today, let's just call it a day, man. I'm gonna try to be brave and go back. They're gonna start something new there. Yeah, I'll have to come back.
That's crazy.
So that's one day where like it took me back in it when I was like, nah, this is something where I feel like this is mad because obviously, bro, like it's before the way you see it. Like, see for example, seeing a dead body. The way you see it on that day is how I saw it because we've not learned anything yet. We're gonna learn by cutting the body open to learn anatomy. So right now I have zero knowledge. So this is not educational for me at the moment.
This is just pure experience.
This is just, and we didn't even cut nothing today. We just had a look. So for me,
is it?
The first day was just fast to look, bro, just to get everyone comfortable. The next time we're gonna cut stuff. So I'm even panicking before anything has started, bro. Like, do you get it? So, like literally. So, but that's what I'm saying. I'm saying as a layman. After that, yeah, when you read it in the book and then you come and see it in practice, it's a bit more like, oh my god, it's here. It's here. Oh yeah, I know this. I read this the other day. Before that bit, it's just like raw, like what's happening? What's happening, bro? Like this is mad. Like
that's mad. So do you think they showed you that too early into medical school?
No, because you need to learn anatomy in the first couple of years. Like, how are you gonna?
Yeah, no, I hear it, but like you say though, innit? Like without context, just seeing a dead body lying on the table, it's like, fuck, that's a dead body on the table.
Can I be honest, bro? Maybe there was lectures that was there wasn't. This was one of the first weeks. But can I be honest though? Like it takes we did anatomy for like a year and a half, man. Damn. You can't show me that at the end. You have to show me as we go.
Maybe like 2 months in, once you've done a little bit of practical and theory and not.
Can I be so honest?
They've done a little bit of theory and like they tried basically explain.
I'll be honest. It might have been within the first month. It wasn't definitely the first day. It was like maybe like in the first month or like first 2 months. Weeks. But like I'm just telling you what I remember. Yeah, this is the first time I felt this way. So whatever months it was in, I didn't feel like I was.
So the next time you went back here and you actually had to cut the body open,
yeah,
what happened then? Was you better prepared?
Yeah,
did you have a similar experience?
But you have to understand though. I was the only person that was scared. I was in the minority. Everyone else was calm. Everyone else was excited. Yeah, that's true. Man was like, oh, I wanted to come to because they can teach enough of it. It's called pro section. So dissection is you dissect yourself. Pro section is it's in a jar and you look at it. But dissection is like the best way to learn, isn't it? What people say, and obviously I definitely agree with that. Because even as someone that was scared, I learned a lot. So lots of people say, for example, your dream is to be a surgeon. This will not be scary to you.
Yeah, it shouldn't be.
So I was in the minority. I was in like 10% of people or 5% of people. Like there was literally me and 4 other people in a group of maybe like more than 100. Because we were in a group of 8. There were like I think 12 groups.
Oh,
you're good at maths. Worked out. Yeah. What 96? Yeah, bro. So I'm 96 people. There's 4 of us. So I'm not like the standard person. I don't know why it got me, but it got me, bro.
That's crazy.
Yeah.
What was your experience like then at uni with like private school kids? Did you become friends with them? Did you notice maybe differences about how they would treat you and the other friends would treat you?
No, I was blessed, bro. I'll be real. Like, them man was calm. Like, like I said to you, it's only like when I started talking to them to get to know them, I started like, so for me, I never saw myself as different as anyone. Nice. Like, because, you know what I'm saying? The same way I was talking about the guy with the book. You don't know until you compare yourself with someone. Yeah. So, for example, like, I never saw, only by the end of like, medical school, I started realizing, wow, like your life was different. So for example, like we were just talking calm, we were all blessed, like no problems, like obviously like in medicine, like black people are underrepresented anyway. So I wasn't expecting to see black people. I was ready to go and see like the people that I was seeing at the interviews. You know what I mean? Yeah. So it's blessed. Like I don't particularly. I'll be honest. I don't particularly even really need that. Like I feel like I'm cool with everyone. Yeah, do you know what I mean? I don't really. It was calm for me, but it's only when I started talking to them, and like for example, I was talking about like, we must play table tennis or something. And I was like, why are you talking at table tennis? And I was like, nah, yeah, bro, I used to play at youth club. And then someone asked me 5 minutes later, bro, what's youth club? And I was like to them, like, hey, bro, this guy don't know what youth club is. And everyone's like, nah, I don't know too. I was like, what? I was like telling them, like, it's like, it's like a club, like it's for the kids. There's activities, keep you out of trouble, this, that. I start deep. Oh, like you lived somewhere, you didn't have trouble. Like, it's only through those things I deep that us men are like
two different.
Like we have different experiences going on, but like we're here now. We all like doing the same thing. It's blessed. Like no one ever looked at me some mad way. Do you know what I mean?
Yeah, here it is.
Some of like when I was at uni, some like I'd say like the black people, yeah, it's who I just thought like, I don't know, like, you know when they make societies by like race, so like there's ACS obviously, like African Caribbean society, they don't have like India society, they'll have like just to meet your own people, innit? I just thought, yeah, I'll go, like it'll be calm, there'll probably be like parties, food, whatever. Some of them people I'd say they were kind of like from, I don't know, I'm just making assumptions in it, but I'm just thinking from the way maybe they saw me. They were like from like affluent areas, yeah, and they also might have gone to like a good school kind of thing, or grew up in a good area. So obviously they probably used to be like the only black person. So if you meet someone like me and I talk this way and I dress this way, all you know is Jerem TV. So you're looking at me like, this is mad, bro. You know what I'm saying? Like so with them, man, it was a bit like, I see they're a bit offish, and I was thinking, at the beginning I thought maybe they was gonna like me, innit? But then I was started thinking like, what is it? Obviously we had a couple of convos and that. I just feel like I just made them feel some uncomfortable way, but bro,
how do you make them feel uncomfortable way though? You know what else I think it might be too, yeah, is that like when you was talking to me about how the people in school that you share time with, that you could study with and all that sort of stuff, yeah, it's interesting, isn't it? I think coming from a place where you're not in an affluent area like they are, yeah, you always tend to look at these people differently, or you're almost inevitably taught by your environment to look at these people a little bit differently. But they always just look at you as if you're the same as them.
Look at them differently. How?
As in like, but I don't know. Maybe it's just my experience. Maybe it's just me. But I've always been taught that money changes people. Like if people have a lot of money, they had to have done something bad to get there, or like rich people never look at us working class the same, or like people from a different social class never look at us working class people like in a similar manner. Like we're also just humans and all that sort of stuff. But I've had the contrast of experience in it. So like when I was younger, I always used to look at rich people like that. And bro, when I was in Kings, that's why I never got along with anyone, because I never gave them the opportunity. I never gave them the chance, or at least gave myself the chance to speak to people and get to know people, innit? But now that I'm a bit older and I have, yeah, I like. The more I speak to people from different social classes, from different areas, from different countries, whatever it is, I've realised that those are actually the people who tend to like most times just not care about that sort of stuff.
Bro, let me tell you something, yeah. Them man don't care about you, bro. Them man's life is good. They don't care about you, bro. They're not worried about you.
Exactly.
Like, and that's what I asked for. You might see them differently. I'll say it this way. When I was like growing up and that, obviously I've had like different circumstances. When I was growing up in that, I'd say I looked at people, not even kids, just anyone. Like if you have like I don't know, like your life's just patterned, you got like a good house, like you go to a good school, like people that went to this school are gonna go far kind of thing. I look at you with envy, innit?
Yeah.
But envy is different than jealousy.
Yeah.
Jealousy is like, I want you to, like, I'm angry that you have this. I'm looking at it like, I wish I had this.
Right.
So when I went to like uni, I never asked no one's background. I was talking to everyone normally. I kind of assumed everyone was in the same boat as me until I found out they weren't when I had the further convos. But the way I see it, yeah, I don't think they saw me differently. I don't think I saw them differently. Because the way I look at it is, bro, the reason I'm doing all this stuff in my life, yeah, and going through all this like struggle and like trying to study and get a good job, is so my kids can have that. So how am I gonna hate you now?
Yeah, it's true still.
You have like your mum done well, great, bro. Like man is happy for you. That's what I'm trying to do. Do you get? So I don't look at it from some way where like, oh, I hate you. Like you lot are going on a skiing trip. Like I'm not coming, bro. Like listen, this is something why these people don't care about you. I was playing football, literally like 3 years in. I'm talking to a guy. And I'm like, oh, you know, that's just the normal convos, yeah? Like, he was new to the team. I just said to him, oh, we did after the game. By the way, obviously, the game starts at 2. The game ends at 4. He's like, oh, I'm going to go watch Man United Leicester. I was like, well, yeah, what are you watching it? Like, he's like, no, I'm watching it at Old Trafford. And I was like, bro, are you mad? The game starts in an hour and a half. Bro, man's now found out, yeah, the guy's dad has a helicopter and he flew him in a helicopter to go watch the game. And man's telling me, like, he's got, like, he was just telling me, like, something about, like, he's got, like, a house, like, someone else told me this about him, like he's got like a house, yeah, to go like skiing in like the Alps or something, and then like he goes there once in a while, yeah, but then the time it's there, it's just empty. He's never renting it. He's like, why would I rent it? Like, I don't need to rent it, bro. But deep it, this guy I've known.
That's mad.
I've known him, yeah. Like obviously, like this person we play together, but part of the club, innit? Like different teams, but part of the club. Loads of times, like go to like the bar, like he buys me a drink, I buy him a drink. Us men are cool. None of these things come up. Like no one cares because trust me, his life is patterned. He's not watching me. There's nothing that he wants from me, bro. Do you know what I'm saying? So it's a thing of like, you could look at it in some way where like you could victimize yourself and look at it like, oh my God, like he's not gonna like me. trust me, like
I think that's what I used to do when I was a little kid. Still.
bro, me, I proper like, I'm them people like, if you have it, fair enough, yeah. Because in my mind, I got like a competitive spirit in it. I'm not saying I'm gonna get a helicopter like him, but I'm just saying like,
At least I can put my life.
I'll get to the point where even someone like you can't look at me like I ain't done well, especially where I'm coming from. Like I would have done well anyway. So I'm looking at it like, okay, if this is what you're on, my new minimum needs to be somewhere higher, and I just work towards it. I'm not really looking at it like, oh, like you're gonna hate me, you're gonna think I'm this, you're gonna think I'm that. Honestly, bro, I tell you, like with them, it's like, you know how it is with man them, like you'll meet someone, you don't even know, like you'll be telling your girl like, like I like this guy, he's my guy, you know. She'll be asking you questions about him, you don't even know. Like where's my work? What's his? I don't know, bro. Like has he got a girl? Yeah, how long has he been with her? I don't know. Like the fact you let me find out you've been married for 5 years. So that's what Osman was. Literally, it's just like you're a good guy, I'm a good guy. Osman can laugh, Osman can play football, Osman can drink, whatever. Like most of us still like keep in contact with now. Like yeah, bro. Like we're calm. Like do you get what I'm saying? Like bro, it's blessed. I'm saying them ones that it wasn't like it proper wasn't that deep. Like but with certain people there, like with certain people, like when I said like when I went to ACS and I thought that's people I find like the most connection with. Bro, I'm hearing people saying stuff like, oh, watch out for Dami and his friend, like them lot are not like serious and they do bad things. I'm thinking, bro, like, how can you say I do bad things? Yeah, I'm on the only course in this university you need to have a CRB, bro.
Really? You have to have a CRB?
Yeah, of course. How are you going to be a criminal and you're going to go be a doctor?
Right, that's true still.
You're going to go and see vulnerable people so you can extort them, bro? Of course not. So I had to do that like when I was like 16 when I was applying, bro. So I'm saying, if this is the only course that you need to have that, how can you that does something else tell me that? But what about you? Where's your CRB, bro? If you got one, where's your DBS, bro? So like that's when I can see that like that's the day I just said, yeah, they hated me without reason, bro. Like,
how do you think that was though?
I don't even care, bro. Honestly, I don't even care. That's mad. I told you what I think. I think maybe because the area that they grew up here, they've been surrounded by people like myself, and people like that will speak or look like myself in their like life have always been on mad stuff. Right. So they're just seeing it like tracksuit, South London accent. He's on mad stuff. Forget that he's here being a doctor. This is what he must be on in his free time. Yeah. Even though it doesn't make sense. But this is the thing. I didn't think about it too deeply, yeah. Because I even deep going to uni is something that I said like, bro, I'm happy to chill with anyone. It's not a racial thing. It's not a religious thing. Whoever's cool, like I'm cool. And one thing that like I learned in it was that like race is the thing, yeah, but it's not a be all and end all. I thought that like I'd find common ground with them people there. Like we might like the same music, we might eat the same food, we might have the same beliefs, yeah. But I found more in common with just the people that I met at football. But why is that though? What is like binding me and the football people? We have a similar hobby. What's binding me with the other people? We're just the same skin color. We could be completely different people.
It's true, so.
So one of them is like, I've gone out of the way. We have the same interest. Do you get it? Like, us can find some sort of mutual ground. We're interested in the same things. Like the jokes I think are funny, you think is funny. Yeah. The motives you might invite me to, I might want to come. Whereas here it's like, by chance, we're from the same country. Why would I see that? And it's not even a thing of say like, I don't know, we're both from the same country and we grew up in the same country. Bro, like we're just descendants of like the same people. You grew up in like, I don't know, bro, Manchester, and I'm from South London. There's no one thing, maybe the food we have at home, but that's the only thing that we really have in common. Do you know what I mean? Like,
yeah, nothing much else.
So I don't know why I was expecting for us to be close like that, but that's what I was expecting, innit? I thought like these would be my guys, but they didn't end up being my guys. But even then, I wasn't like hurt by it. I was just kind of like, I was just don't, like, we ain't got to be friends, we ain't got to force it, but just don't chat about me, man. Cause you don't know me, like, why are you saying these things, bro? You're saying it to other people, and then people will just start rumors. I don't really care like what like other students really thought of me. I never had problems with people. I was cool with people. But I'm saying if someone thought I was a prick, like just don't talk to me, innit? Like I'm not gonna.
Are you a confrontational person?
Not really, man. Like, bro, put it this way, if you disrespect me, yeah, like it's a sense of I have to talk to you about it. But if like for example like, but disrespect is like I need to put it away. If basically you try to like ridicule me in front of people, I have to talk to you about it. Yeah. Like, do you get what I'm trying to say? It don't have to be a conversation, but I'll address it. I wouldn't just like cry quietly. But for example, if like I don't know, you say something, I just don't agree with what you're saying, or like what you're saying is wrong, like objectively wrong, innit? Or like you're just saying some stuff and I don't really like you. I wouldn't confront you. I'll just not talk to you because for me, it's no benefit in me talking to you.
Okay, yeah,
I don't care about changing.
Yeah, that's different. Yeah,
I don't care about like I don't like you could think this. Do you know what I'm trying to say, bro? Like you could think that this is great and this is great and what I'm doing is rubbish. What I'm just making me happy. I don't need your approval, kind of thing. So as long as you're not like offending me, we'll have to even have a convo. I'll just go my way, bro. Like literally, the same way I said, like I just want to go chill with the football people because them and there we didn't have like I wanted to go out, they didn't want to go out. Like I wanted to do certain stuff, they didn't want to do certain stuff. Like the things that we found interesting were different. Yeah. So are we just gonna sit here and both not enjoy our time by force? Like, I'll just go play football and go to the bar with them, man.
Yeah, I hear it. Still.
Cool, like.
Did you ever confront the ACS lot and talk to them about it? And if you did, like, what was
No. So what happened?
Just went separate.
Long story short, like, I tried to join the society, yeah, because I was just like, I know there's bare people like me.
I can't remember. I came to like one or two little things.
Bro. I tried to join because bare people that felt the same way as me was telling me, innit? Because obviously I see them in the library and they're like, do you go ACS? I was like, nah, I don't go. So like, me too. So they were trying to basically say like what's it saying now, like, kind of thing. But that's just because the events they were putting on, yeah, just wasn't for us. I'll give you an example. Like, obviously, uni starts in September times. And then obviously freshers is like it's like obviously catered to a certain demographic, which is the majority demographic, which is fine. But I don't really listen to like when I go out on a night out, I don't go to pop, techno. Like, I wouldn't, that's not really. Don't get me wrong. Like, I'll go with someone, but I can't do that every week.
Yeah.
Like, it's a one-off. Like, if you invite me to like a Spanish joint, I'll come, but I wouldn't tell you you're gonna see me there without you every week now.
Yeah.
So freshers wasn't that great, kind of thing. So obviously everyone's gone to ACS to kind of like meet their people, kind of thing. No one's got friends yet. It's the beginning. But then, bro, obviously October's Black History Month, innit? So, bro, I'm just trying to turn up. I'm just trying to say let's go on some nights out.
Yeah.
They're trying to give me speeches, man. I think it's important, yeah, but I don't think it's the time and place. Do you understand?
Yeah.
Like, imagine like, so, bro, there'll be like an event, yeah. It'll be like a 1 hour talk, but then everyone will chill for like 3 hours after, just mingling and getting to know each other. So surely that should have been the event.
Yeah.
You get it? So I saw that, yeah, and other people were telling me the same thing. So when I was saying, do you still go? They were saying in a way of like, in October, basically everyone dropped off because we were just like, you might have doing 2 events a week because they said it's Black History Month, that's the double the events. 2 a week, yeah. Half of them was like Black History events, but can I be honest, I can't remember what it was even about. It's not like the stuff in primary school they teach about Muhammad Ali and Malcolm X and that. It was more like, but can I be honest, I can't remember, but it wasn't like the history of black people. It was just more like targeted at like certain things within black people. So not all of them even like relate to me personally. Do you know what I'm saying? And the other half was like finance events. Because essentially, because of the way that internships and finance and at work, they need to start recruiting people from September, and then when you get around to it, you start getting accepted later on, and then you start your thing in June. So half of it was that. But I'm going to be a doctor in it. I don't need to go to the networking events for finance. Yeah. The other part, I went to a couple, but it wasn't really interesting to me. Start coming. So when you start seeing people in the library that, do you still go? It's like, did they ever start their motives? And it's like, nah. Then us all start talking, then I started deeping. I started in the same boat. There's a couple of us, and what happened was similar about us, and that's how I kind of started putting the pictures together. We were all from London. Like, we were all from London, innit? So we were just all like, yeah, like, I'll just chill with my home friends, innit? It's not that deep, innit? But we all felt the same way, and that's why I was just like, it's surprising. So I said, all right, let me go and join to be like a spokesperson for them people. So I literally just came on the stage. I have to say like what you want to do, and I just said all this other stuff you do, the careers, the sort of like, and it's even weird to say it because me, like, when it comes to like black people and like say empowering black people and doing stuff for your community, I'm someone who's done that. Like, even for like when I went to medical school, bro, I've taught like 40 other people for the interview to get to medical school, and they all got an offer. Like, I've gone to Ghana to do a medical mission. Like, I'm for that.
Sick.
But here's the thing though, I'm someone like, if we want to do something, let's go and do it.
Yeah.
How I feel, I may be wrong, but from what I remember, them that wanted to just go in a room and just talk about stuff, and then we all just go home after the convo. It's just like a think piece, like. But like,
I get what you're saying.
I'm not even saying they were saying that we should do this or we should do that. It's just like talking about the problems, but like, we're not doing nothing about it. I didn't see value in it personally. I was kind of bored by it. So what I'm saying is, I just said to them, you lot keep having them events. You lot are having a turnout, yeah. So people want to hear it. I'm not telling you you're wrong. Do your thing. I just don't need to come to that. The finance things ain't for me. It's also not for them people I was talking about. They're not doing medicine, but they just wasn't interested in finance. So it's like, you need to have something for like people that just want to like meet people and mingle and have social events. So you lot keep doing that. I'm just coming here to make social events. Everyone voted for me. I got the most votes to be events. Yeah, there was 3 positions for events, and I got the most votes in it. So evidently, people was with me. Came to the thing now. I kept trying to like suggest let's have like a meet and greet. Let's have like a mingle. Let's get all the ACSs from London and do a joint party because we ain't got enough numbers to do it on our own. Let's do it with everyone. Everyone can know each other.
Yeah.
We can have a community. But them lot told me that nah, it's not a good idea. I wouldn't come to that. It's like I wouldn't know anyone at the beginning in freshers. 1 year later, UCL proposed the same thing. Everyone came. But these lot just kept telling me I'm wrong because I'm still the same kind of people. I'm asking the people that was making it a way I didn't like it to now prove my ideas.
Yeah.
When they thought my ideas were bad from the beginning, it's just that the people voted for me. They didn't vote for me. Like, no, I know the committee, they voted against me, which is fine. Like, if you don't, I also might not vote for you if there's a different candidate, but it wasn't. But I'm just saying, so it's a thing of
that's kind of like politics in a nutshell.
Yeah, no, literally, bro. So it's them ones there. It was just a thing of I was just there to like do like events and try and make it lit. But every time I'm making an idea, it was getting shut down. So then I stopped even doing, because obviously before you make an idea, you got to go talk to all the people involved. Oh, would you like to do a party with us? Would you like to do a party? They present it as everyone's down, or you down, let's put it. Everyone was not really on it. They wanted to just keep having these like corporate events and that, which is fine. So in the end, what basically happened was, yeah, like they tried to do like a social event, but they just kind of messed it up. And then they tried to like, not blame me, but they tried to
throw you under the bus.
No, because it wasn't even my idea. So, bro, I don't really watch films, bro. They tried to do a movie night, and they just messed it up. I didn't know they messed it up, yeah, but bro, they tried to do a movie night, and then I was just like, the reason it messed up because it wasn't planned, like it wasn't planned correctly, and it wasn't even my event. I wasn't the one that I just made the name.
Did you do any events in the end for them?
Bro, so listen, this was like in October, yeah. So I was literally there for like 5 weeks, yeah. And by the end of it, I just said, bro, like they basically tried to kick me out, but they kicked me out, yeah, for missing many meetings. But I think that just means I left. Do you know what I mean? Like I just said, bro, this is long. Like I'm not even coming to this. Like and everyone was telling me like, oh, but yeah, like don't try to come to the show at the end of the year for free. Like you're gonna have to pay like because you've left officially. Like you can't come as a member. I was like, I'm not coming anyway. Like I'm not even coming. And then when I didn't come, they're like, I can't believe you didn't actually come. I was thinking, I'm not coming to spite you. I don't want to come. But they couldn't understand why I wouldn't like this. But that's the thing, like you meet different kinds of people, and that's what I said. There's no point in me keep forcing with these people. I just started going football and that, like it's calm. Obviously, I was going football anyway, but I started going to their socials and that. Do you know what I mean? Yeah, but obviously for me, it was like weird at the beginning. Like, them lot was like, go football, go bar, which is basically a pub. Before I started uni, bro, I probably drank like 2 beers in my life. Didn't really like it, man. But then when you score the winner and everyone's buying you drinks, it's rude not to drink it. It's not rude. It's rude not to drink it, bro. So you have to drink it. And obviously, I scored a couple goals. So I started drinking. I was like, yeah, and I can get this down, man. It's calm. But then deep, that's what I wanted to do. I just wanted to play a sport I like and just celebrate with my friends. I don't want to sit down and
listen to corporate bullshit and talk about how you're gonna change the world and not do it. Like,
it's not even about how you're gonna change the world. You're just talking about problems, bro.
Yeah, that's it.
Like, yeah, it's for some people. Obviously, they have enough people, but it wasn't for me personally. There's no point in me pretending in it. So yeah, so for me, it was like I had they started a different thing later. It was called African Caribbean Medical Association.
Okay,
but then deep it, what joins us? We're doctors and we're black. It's not that we're black. We're doctors. So that's what we have in common. The same way football is. We all play football. With that, like I tried to I tried to like contribute to that bear. Like yeah, it was something I was started recently. I tried to contribute to that bear. We did some events and that was good. I enjoyed it. Yeah.
Fairs, man. That's jokes. Yeah, uni experience is wild for you.
Yeah, bro.
That's mad. I do in a way envy it though, because I dropped out after 1 semester and I never really gave myself the opportunity to like, don't know, just
you never knew if it would change, innit? Yeah, but at the time you never know, though, innit? But for me, it's like, bro, like, I had to go this way, innit? So I had to stay whether I liked it or not.
I hear it still.
I guess the benefit I had is like, bro, I just went to go chill with my friends. My friends didn't go uni, innit? So they still live down the road from me.
Oh, okay, that's
so after uni's done, I just go back up with them. Like,
yeah, I think a lot of my friends ended up going to like unis outside.
Yeah. So you just kind of your own in London, innit?
So it weren't really the same, yeah, man. Yeah. I hear it still. Hey, question then. You see how you studied medicine for a while? You've obviously been in multiple practices for a while. Well, each one for a short while, but overall for a while. Is there anything you'd say, yeah, that you've learned from your time studying all these things that you just take now on your day-to-day life? Or do you feel like you still very much just, that's one thing and your day-to-day life is separate and you just do your own?
No, so one thing I'd say is pretty simple, but I'd just say it's like, be organized. Write things down, yeah? Don't come late to stuff, yeah? I'd say, because put it this way, I'm someone, yeah, but if you just call me over there, I'll be a late comer in it. But if I'm doing something serious, yeah, it's like you have to be on time. So I'd say being organized and putting things in a rational way. If you come like even 5 minutes late, you're already catching up. So you can't do that. So what I say is a specific reason I learned that, yeah. So when I started working, my first sort of like rotation, I worked in surgery. So what we'll do, we'll go see all the patients. Then obviously the consultant, which is the boss, will make the plan. And obviously we'll just write like what the plan was. So then, say for example, we saw 20 patients. We're in a team of 3 people. We're just splitting it 7, 7, 6, right? So there's 7 people I'm in charge of. There's 7 people my friend's in charge of. The other one's got 6, yeah? For them people, the plan that they said you have to execute it. So order this drug, change this medication, write this note, and then not obviously the instructions there for the nurse, like, could you please do this? This person can now eat and drink. This person can't eat and drink. And obviously if you mess up here, like you don't write on somewhere, this person can't eat and drink, they're for surgery tomorrow. Yeah. If they come in the morning, they book the surgery for him, like, he's eaten and had food, eaten and drank, yeah, he can't have the surgery. But then you can't replace him with another person because that person's probably eaten as well. So it's going to mess up the whole thing, innit? So one thing I learned, yeah, was when we were writing, like when we had all the tasks, people were writing on paper. I didn't understand why, but I just followed them because they've been here longer than me. They know what they're doing. But when I started realizing, even when I was writing on paper, how many things I could have potentially forgotten here, it started making me think, how many things in my life was I meant to do and I forgot? But it's just that I'm not going to pay for it now, I'll pay for it later. Do you know what I mean? How many times, I don't know, you had a parking ticket, you paid on time, some application thing, you forgot it was today.
I feel that one.
Do you get it? So it's them ones there, yeah, like, it's them ones there. That's one thing I'd say, I talk with me, it's like, writing things down on paper, yeah, because then you can literally, or on your phone on like to-do list, because then you can tick it off, because when you know you have a busy day and you have loads of things, if you have it on paper, it doesn't take any mental strength, you just read it and you say, oh, that was that, I just write it. So that's one thing I'd say, like, that's one thing, like, I just say, it taught me the most that I took it to my personal life, for sure.
Fairs, man. But nothing like health-wise, nothing like medicine or...
Yeah, but I learned that in medical school, though. I wouldn't learn from working.
Fair enough, but like what? Like what's some things that you took, though? Like what if let's say, for example, there was a person here that wanted, well, myself, but they said, like, cool, in all those time, in all the 5 years that you spent learning, what are some of the just like the basic health things that you took from like that time that you think everybody should know that will benefit them?
Oh, essentially, like, do things in moderation, yeah? There's like regulations for a reason, there's recommendations for a reason. So put it this way, like, this is just like what I think personally, and this isn't like absolute fact. But I'll just say, like, if you, obviously everyone eats sweets, everyone eats like takeaways and that, as long as you don't make it like an everyday thing where this is what you're primarily doing, you'll be alright. Do you know what I mean? There's two ways you can mess yourself up in it. If you do low level bad things, yeah, like eat McDonald's, let's say, you do it every day for a long time, you'll have problems.
Yeah.
Or if you do the other way, you do everything right,
High level bad.
then you go and do like hard drugs. All of it, bro, something can happen on that one day.
Yeah.
So basically, you need to find a way, yeah, where it's like you're doing, say for example, like, I don't know, having a drink or something. If you have a few drinks and stuff, fair enough, but space out in time. Have a plan in it. Don't just be getting smashed and then you have no plan and then you do this every day and it becomes a habit. Then all of a sudden 10 years have passed and you're like, oh right, like this has been here for 10 years and then now it's some sort of like irreversible damage. You know what I'm trying to say?
Yeah, okay.
So like one thing I'd say is like, don't try and dwell on things that are like irreversible, things that cause mad problems. Look into what you're doing, man. Like, bro, you can literally, I don't know if you're in your school, did they have like talk to Frank at your school?
Yeah.
Bro, you can just go on the website, yeah. Just
do they still have that?
I don't know, maybe. Probably.
I don't think so. I haven't seen it for a while still. Well, the adverts anyway.
Yeah, but the website's probably still there. I'm saying, just, bro, just don't just close your eyes and do things your friends are doing it. Just go have a look, like, do you know what I mean?
Do research for yourself.
Yeah, bro, honestly, because them ones there, like, this is the thing, bro. If I say to you, like, I'm going to jump out off your balcony now, yeah, if there was 5 people and they all say they're down, it don't mean that, like, because we're going to do it, you're going to live.
Yeah.
We might all die now. It doesn't mean because everyone is saying something that they're right, bro. You need like objective evidence to like.
I think most people's objective evidence it does tend to go off of like the environment around them though. So like for example,
but that's subjective though. By definition, so? What do you mean subjective is like what you interpret. Yeah, objective is a hard fact.
Yeah, so objective is also the evidence of seeing other people around you do certain things and how it affects them. Or would you say that's subjective because not everyone's affected by the same thing the same way?
No, but that's different though because put it this way, yeah, you could say my friends eat McDonald's every day. And objectively, they're not fat. That's a fact.
But subjectively, no, not really.
No. Objectively, they're not fat. Yeah, that's a fact, innit? But I couldn't say my friends all eat McDonald's every day and they're all healthy. That's me interpreting because they're not fat that they're healthy. You don't know what's in their organs. So what I'm saying is like, at the end of the day, everyone has their own mind. Everyone has their own interpretation, yeah? But nothing can beat the facts in anything.
Yeah,
like nothing, like, it doesn't matter what you think. The evidence is there. Let me tell you something now, yeah? Like, even as a doctor, if I tell you, I don't know, if I told you today orange juice is bad for you, yeah, for example, because I'm a doctor and I've got all this medical training, yeah, like, and I'm telling you this, objectively, like, where's the evidence for that?
Yeah.
Like, I can't just tell you something because I've gone to school for it. I can just start giving you any sort of advice and my opinion is worth more than yours, yeah. The point of me going there was to learn the objective evidence to present to other people. It's not for me to now start like, obviously, don't get me wrong, some things are undiscovered, like, it's still medical research. Obviously, me using my best sort of interpretation has value. That's literally what a doctor is, isn't it? But I'm just trying to say, like, you can't, like, I can't make up the rules just because I went to medical school.
Yeah.
It's just like, at the end of the day, just look at what the facts say. Do you know what I mean? Like,
keep it as simple as
well. It says smoking causes cancer on the packet, yeah? If I sit here and tell you as a doctor smoking not cause cancer, it doesn't make it real. Like, it doesn't change reality, bro. Like when you call me in 20 years and it goes wrong, what am I going to do for you? Say sorry, fam.
Yeah.
Like, do you know what I'm saying? I'm saying, like, for people, like, just go get your own objective evidence, yeah? And just know where kind of, like, how you want your life to look, yeah? And kind of how you have to like live your life for your life to go that way. Do you know what I mean? Because at the end of the day, bro, not even in medicine, just in life, innit? Nothing's free, bro. Everything's got a price, innit? As long as you're willing to pay the price for whatever you're doing, that's fine.
Yeah.
But don't like do a certain thing or live your life in a certain way and then be surprised at the outcome, innit? Is it? So literally, what I just say is just give things a bit more thought in it, and don't just like. And what I've seen a lot is just don't just like follow like your friends kind of thing.
Yeah,
do you know what I mean?
Do your own thing.
Literally.
At what age did you realize that you have to do your own thing?
Nah, bro. Like I'll be honest.
I'll be honest with you. It took me a while to get there, bro. But not just to get there, but to also follow it too. I think no realizing what is one thing, but following it is another. I still struggle with that now.
No, I'll be honest, bro. I was always like that, but I think it's because like the environment I grew up in, yeah, it's like. Bare like mad things were just happening, yeah. Like I had friends that like they'll just make one wrong decision and something mad will happen, and it's like got mad repercussions, yeah. So I had to like learn from like other people's mistakes, yeah. Like it couldn't even be me. Some people have the luxury, yeah. When you're in like a say a sheltered environment, in a sense, you can learn from your own mistakes. Yeah, I'll put it this way. Say for example, if I had an older brother, if I get rude to someone and now he's got an older brother, his older brother's coming to get me. If I have an older brother, my man can deal with it and then tell me next time don't do that because you don't know who the person's brother is. If you don't have an older brother and you do that, and my man's brother comes, you're done. So that's how I was. Even in that example, I'm the oldest, so I didn't even have no one to ask advice like that. So I'm saying I had to like look at, okay, my friend might have done that, and someone's come to beat him up. I know now I shouldn't do that.
Yeah,
that's how I had to approach things. So from time I see like objective evidence for, I've seen this happen, this is what will likely happen next, or someone told me this and they're expert in the field, I've read it, this is the facts, I can't dispute this. That's how I just see things, yeah. I try to take my emotion away from it. Whether I want to do something or I don't want to do something, it's just about what's the best for me, and I just do it regardless. Like whether I enjoy it, whether I don't enjoy it, I have to do it, kind of thing. Yeah. So put it this way: when I was in school, in my GCSE, so bro, long story short, like when I was 24, I found out I had dyslexia, which kind of now like explains some things. But obviously GCSEs I did well. I did obviously I got interviewed for medical school. I got an offer, but I didn't make my grades. The teachers at school always told me like. It's weird. They used to flip flop. They used to tell me like, oh, I mess about too much. I'm not gonna be like smart. I'm not gonna make it. Yeah. But then my results will come back. Then I'll get the best result. Then everyone has to be quiet for a bit. Then a couple months later, they'll start telling me the same thing. Like you're messing about. You don't do your homework. You're trapped in the class. Like this is not the kind of people that are successful. But then the results will come, and then everyone has to be quiet for a bit. So it was just like that. But then deep it when I didn't get my offer, now everyone's queries were validated. And what they really thought came out. Because I was thinking, bro, I've missed it by like a few marks, yeah? I can just try again. And then was telling me there's no point of trying again. It's not likely it's going to go up. Like, just go and do something else. So you could tell that they was really thinking, like, I don't know how this guy's progressing through all of this. I don't know if he's a candidate for this.
I always respected that.
But while he's doing that, I can't tell him no because it's going well. But then now, as soon as it's gone wrong, everyone's coming to, bro, my form tutor, that was my form tutor from like year 7, that was taking me to trips, yeah? To like, well, not him personally, but like, he was seeing me going on trips to like, Oxford, Cambridge, them lot are talking to us, this, that. Like I was winning awards and that. I literally this is the first time I've ever messed anything up. This is my first failure of my whole life in 18 years of life. Man is telling me this is not for you, like go and do something else. Man's telling me to go on clearing, yeah, and go do a course, yeah. So bro, I was going to do medicine at King's College, yeah, a top uni, top course. He's telling me to go do clearing in some places where like, bro, I even meet the criteria, even though I didn't get the grade I needed. The grades I have is way higher than what they're asking. Why would I go and do that? In a subject I've never heard of. Why would I go and do that? But that's what they think of me. They just think like, finally it's caught up with him kind of thing. So deep it. Them lot was telling me all of that, yeah. What happened? I reapplied, I got in. I'm a doctor now. They were wrong. When I was in medical school, yeah, I went to America for a bit, yeah. I was like exploring like a career in America and stuff. There's some exams you got to do. They're mad. It's like 9-hour exams, 2 9-hour exams. You need to get like basically 65% to get a good score. It's basically known as like the hardest medical school exam or medical exam generally because doctors do it as well in the world. Like me qualifying in England, I can practice in any country in the world outside of America. Because they don't...
Outside of America?
Yeah, they don't care. They say they have their own exam. If you can't pass this, you can't come in. It's their theory. Because it's the highest standard, isn't it?
Yeah.
So they just said, bro, like, or for that level of medicine at least. So bro, they have their own thing. So I spoke to my supervisor at uni. He's a good guy, like me and him like proper got on, yeah. But he's the head of examinations at King's, yeah. And obviously like...
For medicine?
Yeah. Cool. So he was so I was telling him about my ambitions and I needed him to write me a reference and this and that. And I was telling him, I want to take a year out. I don't want to go straight into work. I want to study for this exam because I want to give myself the best chance. Because you need to not only pass but get a good score. And there was obviously parts like he was saying like, oh no, obviously go for what you want, but like you got to think about it. This is competitive. Like you might like I don't know if you're a candidate for this year. Like from your grades, it's like I can't tell you you're not, but I can't tell you you are. You've not been exceptional. You've been calm. But I know this is a mad exam. Like in comparison to what you've done in it. So he was telling me to just like think about it. But obviously, that's just a nice way of saying.
Have you done it before?
No, why would he have done it? It's only if you want to go to America.
Cool. No, but I mean, he's the what was it what did you say he was?
He's like the head of examinations.
Right, cool.
But it's not an exam. But it's not an exam for our uni.
No, I know, but I'm assuming he studied medicine.
Yeah.
Right, so at some point, the same way you study medicine, you want to take the exam. Maybe he just wanted to do it. That's why I asked, isn't it?
Bro, the exam's like $2,000 for him. If you don't want to go use what it's going to give you, why are you going to go do it?
I hear it.
Yeah, like, bro, he's even a specialist. Like, he's way beyond, bro. Like, it's not... Put it this way, the exam is general, so stuff like, for example, like psychiatry, obstetrics, surgery, he doesn't do that. So them questions there, he might have trouble with, but the stuff that's his remit, yeah, he's going to bang it. Because he's gone. But I'm saying, he's like a person that's like, his CV is mad, isn't it? So obviously he's a really respected person. Obviously, like, he's the head of everything, in it. So when he said that to me, it made me think about it. Like, okay, I have to respect, objectively, I have to respect you. Like, you're the head of exams. You've seen different candidates. Like, you've seen my grades and you're telling me what you think, like, kind of thing. You know me as a person for a minute now. You're in a high position in me as well. So you're even someone, you're not just a doctor in the hospital telling me this. Like, you're literally in charge of students, you're in charge of them progressing. So I have to take it seriously. So I took it on board and I said to him, at the end of the day, like, I want to give my best shot. If I'm short, I'm short. I'm willing to, like, basically, because if I took a year, I couldn't start late. I'd have to, like, start this August or next August. I said to him, I'm ready to roll the dice, yeah. If I do it and I fail, I can never pass and I start a year later, so be it. At least I can die knowing I tried. I'm fine with that. That's calm for me. And he said, bro, fair enough, innit? Like, that's your approach. It's blessed, innit? Like, but I'm saying, like, in a sense, like, at school, they weren't really too keen on me after, like, my first bit of here, he doubted me a bit, but I'm not expecting him to, from the objective evidence, his response was correct. So I'm not going to say that, like, he doubted me in a sense and he shouldn't have doubted me and I proved him wrong. It's not that. He gave me raw advice that was valuable. I sat there, I went home and thought about it. I didn't go home and think he was talking rubbish. So, do you know what I'm saying? A lot of people, like, they never, like, really told me, you're the guy, you can do it, I know you, like objectively, from my opinion, or subjectively from my opinion, you can do it. So, it's always had to be a thing of, this is what I'm doing, this is the facts, this is what I'm ready to, like, risk or pay for it. It is what it is, and luckily, so far, it's gone my way, innit? So, that's how I've looked at it. So, I don't really look at, other people's opinion, telling me, like, this or that. I'm also not going to tell you, at the age of 28, I'm going to go play in the Premier League, innit? Because that is stupidity. But, like, things within reason, or I believe to be in reason, I'm not going to let someone tell me that I can or I can't. Even if you tell me I can, I won't believe you, bro. If you tell me I can't, I won't believe you, bro. It's what I think. Do you understand?
So how did the exam go?
Yeah, calm, bro.
Passed it?
Yeah, calm, bro. No, yeah, I got good grade.
Dang, man.
Yeah, it's calm, bro. Like,
so
it was hard, though.
Do you plan on using it?
Yeah, we'll see, innit? Obviously, I applied for jobs on different places, so we'll just see what happens, innit?
Would you like to go work in America?
Yeah, no, I liked it still. Like, when I was out there, when I was out there in Mayo Clinic, it was proper good still. It made, like, a proper good impression on me. Honestly, like, yeah, and obviously, it's just, I won't go into it because it's not that exciting, but when you apply for jobs here, yeah, you apply for a job, like, it's kind of like UCAS. So say, for example, you apply to be a surgeon, you apply and you rank like 400 jobs, yeah, and based on your exam results, on your interview performance, they'll put you into one of yours. But say the first 100 is King's College, the next 50 is like St. George's, the next 50 is like another hospital. You don't really, like, you don't know what team you're joining, you don't know the people personally, you're just getting allocated a number kind of thing. Whereas out there, it's like, you have an interview with the direct people. So say me and you like each other from the interview, yeah, I know if I pick you, I'll be working with you, and us and I'll get on. Rather than, like, I'm going to a hospital and I don't really know who I'm with. So I'm saying, in that sense, it's more personable. And obviously, when I went out there, the medical training is brazy. I said, the opportunities I was getting in the surgery theatres, in comparison to what I was doing back home, night and day, like, I came back, like, when I was telling them what I was doing, and when I went to go work in the ICU, and everyone was, like, talking and demonstrating stuff, I was saying, yeah, you do this, you do that. And it's like, how do you know? I was like, bro, I've done 50 of these. And I'm like, what? Like, they couldn't believe it. Like, someone at my level's done, like, 50 of them, innit? Because people above me haven't had the opportunity. So, like that. They proper, like, push you to, like, be the best version of yourself is how I feel, innit? Sick, so yeah, like, I'd like to still, but I said I've applied for different jobs. Obviously, it just comes back to see what like I get on the table. But yeah, I would say that's my first choice though.
Fairs. That's crazy, you know. I think that's one thing that I maybe would have not expected from working in the States and being in the States, that they actually push you to be the best version of yourself. Whereas here, it's very much not limited, but
it's not smart. It's limited, but I'll just say there's the incentive is not
harder barrier to entry. Maybe
not even that. The incentive is just not there. Like I'll tell you like this. So see this exam I did based on the score. This from America. Based on the score, you use that score and you apply. You write like a statement. You get references from different doctors that vouch for you. The references are blind, by the way, so I don't know what they wrote. I just say, can you write me a reference?
You have no clue what they wrote.
No, send them a link and they upload the PDF to the link, and I'll get email saying they've uploaded it.
So did you ever get to see it?
No, they can say I'm the worst person ever. Yeah, bro, but that's why it's fair, isn't it? Because they can put their honest opinion. If someone proper don't like you, they can just say, I'm not gonna write nothing good. It's not in my benefit to use an hour to write this when it's gonna harm you. I'm not writing it, and that's fine. But if someone's to write something lukewarm, they're gonna write it. Do you know what I mean? So what I say is like, bro, so you use all these things, you write a statement, all this kind of stuff, then you just send it out to whoever you want to send it out to. They look at the caliber of people they're getting, and they interview the people they like. Then from the interviews, they pick who else they like. Like the interview is more like, it's not clinical, it's more like personal, behavioral questions, that kind of stuff. They pick who they like, kind of thing, right?
So the interview isn't actually based around like maybe the knowledge you might
bro, I've done 2 9-hour exams, bro.
But it's true though, yeah, you've got the knowledge.
Like, bro, you see my score, fam. You know what I know. Do you know what I'm saying? Right. So it's them ones there. They might also want to know your behavioral things. I don't know if 2 things happen at one time. What would you prioritize? Stuff like that. What do you like to do in your like free time? What are your kind of like hobbies? Just to make sure it's not no red flags and that. Don't get me wrong. They want to check they get on with you, but there's not really any hard hitting questions. At least for me, it wasn't. But what I'm saying is, so see that process. You can see that's like it's based on merit, innit? How good were your references, and how credible are the people that referenced you? How high was your exam result? How much experience have you got in the relevant field? What grades did you get in medical school?
Yeah, it's all merit based,
bro. So do you know how they changed it in England, bro? It used to be you do an exam, or all your medical school exams 50%. You do another exam that's like 50%, and then you get a number, and then you rank what job you want. Like, this is for foundation training, by the way. You rank your hospitals, and obviously based on number, the guy that gets the highest goes first.
What do you mean?
So say for example, like someone scored 100 out of 100.
Yeah.
He's the highest in the year, right? So he gets his first choice. All the jobs are available. So whatever he picked, he's getting it. Then it goes down, and then say for example you're like number 10, and you wanted something that's been filled up now, they'll go to second choice. Then you'll get that. So basically, it's in your benefit to be like one of the smartest. You have to just be in the top 10% of the year to score that maximum points, yeah? So everyone was grinding for that. A couple years ago, they changed it. It's a random allocation now. So it don't benefit you it don't benefit you, like, it benefits you clinically as a doctor to be smart, but to perform in that specific exam, it don't benefit you, bro. As long as you pass. If you get 50, if you get 100, it's the same.
Why did they change that, though?
I'll be so wrong, man. Like, I'm not even going to kill them. I genuinely think they opened it up to the floor and the students voted for it. But I don't know why they voted for it, because everyone's complaining now. But
it's probably because, think about it, to be the top 10%, inevitably going to be a lot of people who fall in the 90 that don't.
No, but it's no. But what I'm saying is to get the maximum score, bro. So it goes in deciles, bro. So if you're on the,
but that's my point. Like, if now it's random allocation, and the students are the ones that voted for it, but it's because majority of the students are the ones that ain't getting their placements that they want to get. So they probably just think we're better off just in random allocation because they're better off getting that.
Everyone's complaining now.
It's kind of like everyone's complaining.
But I know what you're trying to say though. The top 10% will never complain. The top 30% probably will never complain. But there's bottom 70%.
It's kind of like with what happened with reselling, fam. In a way, it's stupid. It's probably like such a far-fetched analogy, but it's true though. When I used to resell, bro, I used to go out and I used to queue up for trainers. It was always the people that would grind to get to the front of the queue that would get the trainers, and everybody else wouldn't get jack shit.
And now it's a
raffle thing, bro. Now it's random allocation to whoever wants it, and it's not the same no more.
But that's when I stopped buying Jordans, bro, because I was the people that used to come at 8 o'clock and I used to get my shoes, bro.
Bro, me and you both, bro.
That's bro. Raffle was long, bro. I used to just grind and get my shoes, be gassed. Like, now the raffle is, I can't be bothered to play these games. But what I'm saying is, so see like how one is one way and one is another way.
Yeah.
I'll be honest, see the politics of all this stuff.
Yeah.
I don't actually know that much. Because I've been so focused on my exams and my career trajectory. I'm not even reading into this, bro. I don't even care. Like, I'm not even, like, even his allocations for the jobs for medical school, it wasn't like that in my time. It changed the year after.
Oh.
So I don't even know too much.
You didn't really matter anyway.
I'm just telling you what someone told me, that they had a vote, but the vote wasn't more publicized, and it was like 49% voted for this. But I don't know to what extent like they took that vote. Is it just because of that 1%? Is it the vote had to cross a number? Is it this vote and their opinion? I don't know that, bro. But I'm just saying they changed it like that. So what I'm saying is like, yeah, man, it's just one is just a lot more clear. And let me tell you something now. I'm someone, yeah, I don't want, see the same way, like I said, I'll go with my opinion, and if it doesn't bang, it's on me and I'm ready to take that L.
Yeah.
For me, it's like, judge me for who I am, bro. If I'm genuinely like, if I do my best on this exam and I'm not good enough, and you don't give it to me, give it to a better candidate, that's what I believe in, bro. Like, don't take me out of like charity or something, or that you like.
Yeah.
If there's a better candidate, you're even doing him an injustice. You're doing yourself an injustice because he's a better person than me.
100%.
You're getting a better outcome by employing him. He'll become better than me.
Yeah.
Who does the benefit to take me? It's just my selfish interest. I don't want any of that. For me, it's like I'm ready to say, everyone put your paper on the table. Let's see who wins. Like that's what I'm good with that, bro. I don't have no feelings towards that. I'd rather be in a system where it's like, yeah, it's rather like that. Do you know what I mean?
Yeah.
And obviously, these are two different things because the systems are different. So the foundation thing is straight from medical school. This job thing in America is straight from medical school, but the system's different. Because you know how I said you do the 2 years? In America, they don't do that. You go straight to the specialty training.
Oh, okay,
you just go straight in it. But it's because their medical school is longer.
How long is their medical school?
So you have to do undergraduate degree first, then medical school.
How long is the
undergraduate degree? Is 4 years. Medical school is 4 years.
So they do 8 years in total.
Here, you can go straight from college, 18, you do 5 years. But then you need to do them 2 foundation years, which makes it 7. Do you understand? So it's similar in time anyway, because obviously them lot, when they go start medical school, the first 2 years of medical school for me was like the foundation of biomedical science. But if a man that's done 4 years of biomedical science is not going to go to medical school and learn that because they're past that level. You literally have to learn that to start. So they start kind of like a bit ahead, but it just took them a bit longer to do the initial bit. So do you know what I'm saying? 7 years, 8 years, it kind of lines up. But I'm just saying, so for them, they don't really, the sort of like foundation training aspect, I'd say is kind of covered by their sort of end of medical school, if you know what I mean? So for them, they're going straight into specialty training, isn't it? But I'm saying, it's the same thing here, where if I was to go apply to be a GP or be an ICU doctor here, it would be the same thing. Like, I'd have to do an exam, and after like, maybe not for ICU, but for GP, I'll do the exam, I'll get a score, they'll do like an interview, but then it's also like up to loads of like different things. I feel like there it's more clear, and when I say it's more personal, because even then I'll be applying for all these places, all these clinics, all these hospitals. I don't know who I'm going to see there. I don't know if me and you're going to like each other. I don't know how it's going to be there. All the places I'm applying to are like, could be far away, so I don't know if I'm going to be living in a sec. It's a localized system, right? It's a central system. Whereas there, you apply straight to the place. And bro, honestly, one of my friends applied. One of the places told him that one of the reasons they interviewed him, he had a really good reference from a doctor that the guy knows. So he's like, he's my friend and he's vouching for you. I know he doesn't really vouch for people to this extent. You must be good. And I think that's worth a lot.
Yeah, that is still.
But it's like, it's more personal. It's more like going to
a Bo?
No. It's a guy you don't know. But basically, it's them ones there. It's like, it's a lot more like just applying for a normal job. Yeah, like you need to come to the office, see what it's like, see if I can like it. Rather than like we're all here and we have to like learn to like just coexist in it.
I think it probably does work better in that way, though. Especially if you're in an environment like, I don't know, just in medicine, doing something so heavy, you're working in a hospital in a clinical.
You need
to be able to get on with everyone, bro.
I'll even just say like in like an said example. I'm not saying it can't happen in America. It can, but for example, like you might just go to like a department, yeah, and you're like I don't know, something that's a bit niche. Yeah. You could be like the only woman, or you could be like the only man, and that may make you feel uncomfortable just with yourself or something. Or you could be like the only person of like a certain like religion or belief, and for you it's important to be around your. Do you know what I'm trying to say? But you're talking into the dark until you get an email from the rota person to say this is everyone's rota. Because obviously I see my hours, I see everyone else's hours. I can read your name and try and guess who you're going to be. But I don't know you. Do you know what I'm saying?
That's true still. So would you say America has the best healthcare system in the world? Well, you obviously haven't been everywhere in the world.
Bro.
Every healthcare
can I be honest, bro?
But out of
can I be honest, bro? I'll say it this way, yeah. As of now, I've been there.
Okay, maybe not best healthcare system in the world, but like the best resources, doctors, maybe facilities, but just like knowledge and how everything's done.
I'll say it this way, yeah. And I think like this is all I'm really qualified to say, yeah. I say I went there, I liked it. I did medical school 5 years in England.
Yeah.
That's a long time. I've probably spent a combined time of maybe 2 or 3 months in America. I couldn't like, I told you the pros and cons that I've noticed.
Yeah.
That's really like as far as my knowledge goes. Like I couldn't like, yeah, like I guess when 3 months into medical school, the issues I'm mentioning now, I wasn't open to.
Yeah.
Do you know what I'm saying? So I don't actually have the knowledge. Like it's just for me to go and find out. But that's the like beauty of like doing all these things and getting all these qualifications and doing all these exams that you may not have to do. If I go there and I hate it, I can come back.
Yeah, it's true. Do you get bored speaking about the same thing over and over again?
No, it's not the same thing, bro. It's like more different aspects of it's the same principles but applied to different topics. I mean, if me and you talk, it's not the same as me talking to someone else, but yeah, like no, I think like Bro, I think it's important to think about your life, bro. I think like these kind of thoughts and these kind of combos, I have these in myself bare, bro. Like,
bro, I find that like I live in my head quite a lot, and I have all these conversations with myself quite a lot. But it's hard though, because I find it hard sometimes just knuckling down and doing something about it. Though, do you get what I'm saying? As in like on my day to day, obviously I haven't studied. I didn't go to get a medical degree. I'm not a doctor. I'm not a GP, so I don't have like not certain obligations in my life. But I know there's certain requirements of me to turn up at certain places because I just have to, right? Like I don't have that, bro. Maybe I have my own little paint and decorating company. Cool, that's fine. And like, it's not full time. It's part time. Like whenever works come in, we'll go do it. Obviously, in the meantime, we still go out looking for our own jobs and shit like that. But my day to day, bro, is pretty chill. Like I know I can wake up. I know I can get my shit done. I know I can start editing, filming, thinking about content, all that sort of stuff. Maybe like there's aspects of my life that I should take a bit more care of, which is like my health, exercising, being active, probably smoke a lot less, drink a lot less, all that sort of stuff. And like these are conversations that I have with myself all the time. I need to organize myself better. I need to have a bit more structure and routine, because last year, for the first 6 months, I had that. Fair enough, I didn't have a full-time job last year, 6 months ago. Last year, sorry, for the first 6 months, I had a part-time job. But what it allowed me was clarity in knowing what my week could look like. So I knew I was going to be working Monday, Wednesday, Friday, and every other Saturday. So that meant, and I'd start work at 3 a.m, get back home for like midday, or like 10 a.m, 11 a.m, whenever. So I knew that for the rest of the day I could do certain things. Tuesday and Thursday I had off. I had the whole day to do what I wanted to do, but organize it properly. So I wanted to, at the time, day trade. I also wanted to start a podcast. I was also doing jiu-jitsu. I also wanted to start reading the Bible and all that sort of stuff. Oh, I got a question for you now that I remember I said that. And I wanted to start like organizing my life a little better. And for the first 6 months I did, and bro, like flying colours. Like fair enough, I didn't have everything that I wanted, and I didn't like, achieve everything that I set myself down to achieve, because at the end of the day I only stuck to it for 6 months. But what I noticed was that as I was doing it, a lot of things would start aligning in my life. I did start ticking off quite a lot of the goals that I set out to achieve. I was probably in the best like shape of my life. I was probably in the best place mentally in my life. I had a lot of clarity in my thoughts. Like I was calm. But now, bro, a whole year later, and since I've stopped doing that, and I've just let my life in a sense be a freestyle this whole time, yeah, bro, it's been so chaotic. I find it hard now to just have like certain things in check, and I find it hard, bro, to just get up and be like, cool, today I actually need to go run. Instead, I'll just be like, nah, man, I can just chill in bed for 20 more minutes, get up, make breakfast, and just kind of like wallow along and all do that sort of stuff, innit? So I have the conversations in my head all the damn time, bro, but I find it hard to commit. I find it hard to...
But you know what's mad though? It's a double-edged sword though, because you know what you just described, yeah? I was having the opposite problem, bro. I had so many things to do, I didn't have no time to do nothing. Because you're saying like, oh, like you didn't feel like you had structure, like you can just stay in bed 20 minutes more. Bro, I was literally going to work, coming from work, studying for literally like 7 hours, bro. Going to bed at like 1, going to work at 8, coming up, like, bro, I literally, like, sometimes I won't even eat just 'cause I ain't got the time. I'm doing questions on time mode, yeah. Crazy. I can't stand up and go eat and come back. I've got to finish it. So, bro, I feel like I was doing that for like a year, and that, bro, loads of things, my health, bare things just deteriorated because, bro, going to gym is a luxury, fam. Are you mad? I'm tired all the time. Yeah? I'm not going to spend my one, like, not half day, but my one evening I gave myself off kind of thing, yeah. I'll probably spend my girl, I'm not going to go and do more suffering. Yeah. That's long, bro. I would say it's like, bro, it's a balance, innit? But if you felt like you was doing well before, it's like, you need to, like,
go back and
keep some sort of maybe structure in a sense. But what I'm saying, like, being too busy is also not like a good thing. Trust me, I'm someone that's like, when I was doing that, I was wishing I was doing what you're doing, innit? But let me tell you, this is what I feel like. I'm someone as well, like, even with my health and my fitness, I'd say. So obviously I used to play football, I used to take it quite seriously. As soon as I stopped playing football, I started putting on mad weight. And do you know what it is? It wasn't because of the lack of exercise. Cause so in the pandemic, for example, obviously uni done, football done. We used to go cycling, like we used to do boxing, we used to do loads of stuff that I was keeping active with, yeah. But do you know what the issue was? The same way you said, yeah, I should wake up, but I'm just gonna stay in bed for 20 minutes because there's no price. You don't perceive there to be a price. You feel like might as well. When I was playing football, I used to think like, I'm gonna go eat this takeaway. Then I used to think, nah, when they're playing the ball down the line in the 85th, we're 1-0 down, yeah. I'm not gonna score, and it's gonna cost us. So I'll be like, you know, I'd rather not eat this. And even if I don't score that weekend, if I play good, it's like my perception is benefit. If I would have ate this all throughout the week, it wouldn't be that today. I'll probably play bad. I'll lose my place in the team. I'll be on the bench. That was the cost. So I kind of I was still eating that stuff in like moderation, but I wasn't like, it's not like I can just say, oh, I can't book to cook, I'm gonna go get McDonald's. Whereas now I was doing that because I'm not playing football. What's the cost?
Yeah, it's true.
What's the cost? I'll put on weight. Then when I finish my exams, I'll go gym and I'll lose it. I didn't perceive it to be any sort of cost to me. I didn't see that to like affect my like long term health. As I said to you before, like I didn't see it. The way I see it is not like, okay, if I live my life this the rest of my life, I'm gonna pay for it. But bro, if I get fat for like 6 months, I'll live.
Yeah,
you know what I mean? So the same way is like you're saying, oh, I might stay in for 20 minutes. I'm thinking, yeah, I'll just have a Big Mac. Like, what's the cost? But that's why you gotta like give yourself. I won't even say structure. You gotta give yourself like, I need to do this. I need to do this. I need to do this because this is my goal. If I don't do this, my goal is in jeopardy. And then the urgency will come in it. Is what I'm saying.
I think that's another aspect of it that I'm missing out too, is that I don't really write down things anymore. That's why I was interested earlier when you said that like one of the biggest things you learned from uni was to just write down everything. Write everything down.
Yeah.
You know what I'm saying? I don't do that, bro. I don't do that near enough. I used to, not anymore, bro. And I think not having things written down and having clarity in it, you end up moving your goalposts too much. And when you move your goalposts too much, you can just inevitably go.
No, when you move the goalposts too much, yeah, like bro, it doesn't, bro. That's what messes you up bad. Do you know why? Because it was even with me when I was in this exam, yeah. So it was an exam for me to book myself. There was no set date. I could book any day that's available. When I was just studying for studying sake, when I wasn't ready to book it yet, if I'm tired today and I take a day off today, it's not a day wasted. I'll just book the test a day later.
Yeah.
You can do that forever. As soon as I booked it, every hour that passed, I know that hour is past. I can't get it back. So then I knew like today I'm tired. But the days when I said I was tired before and I took them off, there were days I was 3 times as tired and I still did something because I knew like, bro, mathematically I have this many questions left. I have this many days. If I don't do this today, every other day will have to get harder because I have to add the. So I had to just do it, like whether I liked it or not. But before I didn't have that fire because it was okay. I'm gonna do it on the 10th of June. Oh, do you know what? Like my head's hurting today. I'll do it on the 11th of June. The next day I'll do it on the 12th of June. Then time is passing. I'm not getting closer to my goal because what's the cost? You know what I'm saying? So
yeah, I need to look at it that man.
But he's gonna ask something about religion. Go on.
Yeah, bro. You went to church this morning?
Yeah, come on, bro.
Yeah,
this afternoon.
Have you always been religious like that?
Yeah.
Why?
Bro, I'll tell you like this, yeah. Like, bro, so obviously, like, put it this way, bro. My mum's Polish, yeah. Obviously, like, most, like, okay, I won't speak for other countries, but most of these countries, like in Europe, yeah, like Eastern Europe, like Roman Catholic is like a strong religion. Like, they take it seriously, yeah. Bro, like in my house, I still got pictures of like my christening and that's up, bro. So when I like from them times, I used to go to church with my parents all the time, and then bro, like I even had like a Holy Communion. I had to go learn all that stuff.
Same.
I had to like learn all that stuff. You know what I'm saying? Go to confessions, all that stuff involved in it. So from young, when you're like 8, 9, you're seeing all these things. They're teaching you like wrong and right. They're teaching you all these rules. It's something that stays with you, innit? And what I'd say is, for example, like even if like, don't get me wrong, bro. There's things I do that like, of course, is like it's sinful in it. Everyone is.
Yeah, everyone.
But I'm even putting it in a way where it's like I'm trying, but there's even things where I can't explain it. Okay, you know if you're like trying but you fail, like say for example you're trying to quit smoking, yeah, and you get drunk one day, you just do it. You didn't know you was like that's different. I'm saying there's some things where like I know I shouldn't be doing it, but I'm just doing it consciously. Yeah, I'm just taking a nick, which is bad. But I'm just being honest, innit? Like obviously of the 10 Commandments and stuff, innit? Fair enough, yeah. Like, but it's them ones there where even the principles that they taught me, the values they taught me, it's them ones there. I used to go to church on my own every week, yeah. After I got a car, because my parents, like, we moved house, they didn't really go regular like that. Like, when I was on my car when I was 18, I started going every week, yeah. Like, for me, it's mad important, innit? During uni, these are the times I started going out, all that stuff. Like, I just, Saturday night, I'm smashed. Sunday morning, like, I'm even waking up, man. So, I started taking a mick of it a bit. Like, I lost my way in that sense, yeah. I'd say maybe, like halfway through, then the pandemic happened, there was no more church. Then I started doing these exams, like, I even just completely forgot, like, but then obviously something I'm just like kind of not say getting back into, but making a more conscious effort now. Do you know what I'm trying to say? Because in a sense, what I believe, yeah, even forget like whoever listens, if you believe in God, if you don't believe in God, yeah, I believe, yeah, that like even if, say for example, someone believes God is not real, if you go and like read these 10 Commandments, yeah, if you live your life that way, your life will be better than most people. So what I'm saying is like, I believe in God myself, but this will benefit anyone. Do you know what I'm saying? And that's why even for example, like different religions, yeah. I'm not them people that will be like to you, like you're a different religion to me, like you're going to hell. Like it's not that deep. Like I said, I'll do my own, you do your own. We'll see where we see each other in it. Like, and this is the thing. If I'm wrong, I'm ready to be wrong. Do you know what I mean? But it's them was there, like, even like other religions, yeah, like even I got a lot of friends that are Muslim, yeah, when I see like what like their book tells them, even though it's not my religion, yeah, I can see how this could benefit a person.
Yeah, it also makes sense.
I can see how it can benefit a person. Like, for example, something like not drinking, yeah. Essentially, I believe like drinking comes with more problems than it comes benefits, innit?
Yeah,
I still drink.
100%.
but like I don't see it as it's not reasonable.
Yeah,
Do you know what I'm trying to say? Like, so it's them ones that I feel like, for me, when I can talk about objective evidence, yeah, don't get me wrong, like I would see religion as objective because I believe in it, but realistically it's subjective, innit? No one can show me a picture of God, no one can show me a video of Jesus Christ.
But I
like,
think that's like
the faith aspect.
Yeah.
What I'm saying, I believe in objective things, but this is something where like I believe in it because no one can show me these things. Like, as in, no one can show me 4K evidence that this stuff happened. Right. But yeah, the thing about it is, in that sense, yeah, it's like, bro, that's where the faith comes from. And this is one thing where I'd say it's not based on cold hard fact, innit? But what I believe is like, this is like a good. The person that they describe and the way they live their life, yeah,
it's like an archetypal human.
It's a good role model
to
base yourself on. Like, do you get it? Yeah, objectively, what I'd say is if you live your life this way, you would have less problems. Do you get it? So obviously, I take it seriously, and obviously, even just from like growing up and these things being like instilled in me, it's not a thing of like because I went to church when I was younger that I just like feel like I'm compelled to go. It's more like I genuinely believe this. Do you know what I'm trying to say? So. Yeah, so
I think, to be fair though, I think that's a big thing that I feel like I miss nowadays too. I do miss reading the Bible, fam. I ain't religious, but I do believe in God, and I'd say if I had to base my faith around a particular religion, it would be like Christianity or Catholicism, innit? But I don't go to church, bro. I don't really agree with religion in a sense. It's kind of weird because of what I've seen it does to like certain people.
No, I know what you're talking about. I know what you're talking about. Turns people against each other, like it makes it.
Bro, I don't really agree with that sort of stuff. Like, I don't think that's what it's for, bro.
But that's I agree, but
that's also in the eyes of the beholder, though. Because if you now take it in to like be your fucking,
but this is what I'm trying to say, though. This is what you're not like. This is what I'm trying to say when I said like I see that like religion is like objective, even though it is technical terms subjective, right? Because it's my opinion that this is real to someone that doesn't believe. Do you understand? But what I'm saying is like, see what you're saying, it turns people against each other. People police each other, like, why are you doing this? Why are you doing that? Like, you shouldn't be doing this. You're a bad person. You're going to hell. Like, the same way I said, I'm not, for me, it's for me to be a better person, not for me to go on other people and say, I'm good because you're bad. It's not that. What I'm saying is, see that kind of approach here where people like kind of like, in a sense, like make each other like feel bad and demonize each other. That's a human interpretation of what they've gone and done with the information. The information didn't say you should do that. The information said, treat people how you want to be treated. The information said, you should go and spread the word of Christ. They never said you should go and tell people that like you're moving mad. They never said that you should walk around and be. Do you know what I'm saying? Like, that's not what like. So I'm saying, obviously I understand people. Cool, fair enough. Like whatever church you go to, whatever the priest says, like they might even be saying something that's not completely correct. I don't know. I'm not saying. I don't know where you got it from. It might be your idea. It might be someone else's idea. That's what I'm trying to say. Someone might be feeding you the wrong ideas. It might not be yourself. But I'm saying that's not what I'm been on. In any aspect of life, I don't really care too tough about what people do. Like put it this way, like, unless like you're my family or something, you could tell me like, I don't know, bro, like a random person could tell me that they're gonna like do something that doesn't make sense. I don't know, they're gonna go mop while it's raining, I'm not gonna argue with you, bro. Go and do it, like, go and do it, and then me and you will find out at the end if the floor is dry or not. Then if you ever want to ask me why I thought that was a bad idea, I can give you the evidence. Tell you what, but if you want to go spend your time doing that, you're not my child, fam. Unless you're not harming other people, go and do it, fam.
That's true still.
So I'm not really too invested in like, in school people get into arguments about like, is it Christianity, is it Islam? Like them man will be getting into these arguments. For me, I told you it's the same way with the exam. I'll practice my religion, If I die and I find out I was wrong and I go to hell, so be it, fam. That's it, bro. I'm not here to like convince no one because I don't care about their opinion. Not that I don't respect them, but I just, what I do is not going to be based on your opinion. It's the same way, like, what I think is what matters, isn't it? So if this is what I think is right, then I'll listen to it. And it's funny because it comes into, like, medicine as well, isn't it? Because a lot of things, like, I don't know, like, abortion, contraception, all that stuff, is like, people try and make a medical thing. I'll be honest, like, it's them ones there, like, how can I explain it? I'm in the same sort of thought as well. My religion says I should do this. So I know how I live my life. How anyone else chooses to live their life is up to them. Do you know what I'm trying to say? I'm not here to impose my views on no one. Do you know what I'm trying to say, bro?
I hear it.
And the same way I say, like, even in my religion, like, there's bare things I shouldn't do and I'll go and outwardly do it.
I'll do it anyway.
So even if you tell me, like, I don't know, bro, like, my dad is a priest and I'm like my dad's a priest and like whatever, I go to church every week and I want to go and do this medical procedure that's against my religion. Bro, like you're in your right to do it in this country. Do you know what I'm saying? Like, it's not. I'm not God. I'm not the prime minister.
Yeah, I can't tell you.
Do what you want. Like,
yeah, man, fairs. Yeah, that's funny, man. I think that is something that I do miss still quite a bit, bro. I find.
Why don't you go to church then? Why do you find a better church? What church did you go to?
A Catholic church.
What church did you go to?
I used to go when I was a kid to my local church called English Martyrs, but not the one in Waterford Road.
I know there's another one. I always Google it, yeah, and it tells me some far place.
It's like just across Tower Bridge.
Yeah, bro.
Yeah, I used to go down there because that was the one local to my house, innit? But I don't think my issue...
I got to Wolf Road, you know.
Is it?
Yeah.
Which one?
That's where I came from. English Martyrs, Wolf Road.
Oh, yeah, fairs. But no, I don't think, look, that... And I also, that even though my issue is kind of with organised religion, I'm not really a big fan of it. I think also that my other issue with religion was just how it was given to me and presented to me by my mum. Because my mum is like diehard Catholic.
I know.
So I think that was also a big deterrent for me as well.
I know. Like, even some songs like your sister and that, like, it was like your mum like was telling you have to like believe this, innit? I understand. See, for me, it's bare different, bro, because like, I can understand your sort of thing where it's like someone's kind of made you do something. So like, say you left the house, like you don't have to do it no more. So it's that one's there. For me, it's kind of like, even though this was not saying forced upon me, like they just took me as like a thing. When I was a kid, I didn't want to go. I'm just sitting here like listening for like an hour. That's long, man. I didn't want to go, but it's just that one's there. Like obviously, as I want to actually learn about their religion when I was doing my communion and that, I was like, yeah, like this makes hella sense. I understand like the point of it. Obviously, even in my life, I've had issues myself. Yeah, like just even what's the word? Not like issues within myself, but like just I've been in situations where like I wanted some sort of help. Yeah. And then times that I prayed and like my issue was solved. It doesn't even matter, yeah, for me. This is what I'm saying to you, have to go objectively. It doesn't matter for me if it's like God that did it. Bro, in the time when I thought there was no way out, yeah, I prayed, it made me feel better. Then it's solved. It could be a situation where it would have solved on its own. But did I want to be stressing all that time? Yeah. Thinking I'm lost, that no one can help me. Do you understand? So I'm saying, when I went through that, yeah, it's a thing of, bro, my dad used to be Muslim. Yeah, but my dad is like, he wasn't ever like a mad practicing Muslim or nothing. Like, I think like he was telling me he didn't really understand it, but it was handed down to him, innit? Then when I came to Europe, he just adopted my mom's religion in a sense, yeah, because he was a religious person. Like he believed there's a God, but he wasn't like.
She didn't know how.
He wasn't like, obviously you don't speak Arabic and that, like, you know what I'm saying? So it's them ones there. So he just started going to church, started hearing what they're saying, like he liked it, innit? So I'm saying I didn't come from the most like strong religious family. Like, my grandma, my mom's bare religious, innit? But I didn't come from the most like strong religious family that anyone forced me. Like I told you, I lived with my parents, yeah, for a bit when I was at uni, because I was studying in London. Bro, there's times when I got my car and I was going to church on my own, yeah. Them I was watching TV, they didn't even come with me. Like no one forced me to go, I just went myself. Like, but I'm saying like them man, like it's not like everyone said like, okay, no more Sunday football, we're going church at 11 a.m, everyone has to be there, this, that. Bro, man, I was just going to wanted to go.
There was a period last year in the first 6 months of that year that I tell you I was better structured in that I did go English Martyrs too though. I did go there, the one on Wolf Road for a little bit. And it was nice going there every Sunday just for the sake of going, and no one told me to go because when I was there, nobody else went.
Bro, do you get it? Like, it's them ones there, like, even the stuff they say, yeah, is valuable, fam. Do you get I don't know how that one is, yeah, but I guess it's the same sort of church. Like,
no, it was English Martyrs at the...
It's the same church.
The one that you went to. I started going there.
Oh, you went to the Wolf Road?
Yeah, I went to the Wolf Road one.
Yeah, bro, the guys are couple. What time did you go? 6 o'clock or 11?
No, I went 11 a.m. mass.
11:30. That's 11:30. That's what I went to today, yeah. The guys are cool with it. Like, the stuff they're saying is even like, do you know what? The only reason I asked you, the one at 6, yeah, is even for like an older crowd in the sense, like kind of teenagers. You know the people that went out on Saturday, man.
Oh, okay,
It's all of us, man. He even says some stuff that's even more like, he talks about like relationships and stuff and like stuff like that. It's even more like tailored to like that. But I like going to the early one because 6 o'clock's in the middle of the day. I can't really, it messes them up day. Also, it's a thing where it's like, how can I explain it? There's less people. So it's a bit less vibey. When you got 11 o'clock, everyone's singing, it's all vibes. Like, so, but no, trust me. So, for example, like, see, if I went to another church, maybe I wouldn't like it. But that's the church, I used to live in Aylesbury, innit? So that's the church I've been going to since 2002, fam. So I just kept going there out of habit. It's not like when I started going on my own, found the church and went. I just went to the church I went with my family.
Because it's the one that you went to.
Do you understand? No. And it's local to me still. So yeah, no, bro, like, obviously, see, they just say general things, like, they give you, like, advice. I don't know if it was tailored towards, like, young people. Today when I went, obviously, it wasn't really, they just spoke about things generally. But it's them ones there, like, there's no, you're going to hell. Like, there's none of that. Like, it's just calm, do you know what I mean? Like,
no, I feel you still.
I'll just say it this way, bro. If you found it, like, in your benefit, yeah, not even just church, anything, innit? When you said
reading the Bible is what I found benefiting. I used to read a chapter a day and take notes.
Fair enough, yeah. I was gonna say, like, even outside of that, even when you said the structural stuff, whatever, anything that's in your benefit, you might as well do it.
Yeah, it's true still.
Like, that's what I think, bro. So I find it my benefit to go to church as well. So my bro, there was a time, yeah, when I was doing weekends at King's, yeah, they have a chapel, bro. I was going to church, bro. 3:00 on Sunday, they have a service for 1 hour, yeah.
Oh,
I just went,
yeah,
bro.
I remember that chapel.
I just went, bro.
I remember that
like, I
chapel
just, bro, it's not even my church. That's like Church of England. I just went in case they say something that's I can relate to. 'Cause at the end of the day, it's just me trying to do my best to go to church. No one's looking at this like, this is not your denomination of Christianity. You're going to tell. Like, I didn't see it that way. I just said, I'm just going to go. Like, it's better than not going. Like, I'm going to go.
That's interesting.
Do you know what I mean?
Yeah, fairs. Nah, that makes me think about a lot, bro. That makes me think a lot about, like, even just that whole thing that you said about this is not your denomination, like, why you going there type thing. Like, bro, that's something that my parents still do to this day, fam.
What, like, you have to go to this one, like...
If I told them I'm going to church, like, they're going to be like, is it Catholic church? No, why ain't I going to Catholic church for? That's not your church, like... Do you get it?
No,
like, fair enough now they're a bit more, like, accepting, though. Now they're a bit more...
Now they just want you to go...
Yeah, now they're a bit more accepting because now it's just, I think now they've gotten to a point where they actually realize now, shit, like he's living his own life now. There's nothing I can say that's gonna make him do anything. Yeah. But it will still bother them. It will still say something. They'll still be like,
I can't lie though. I think you just had like for example, like I think like you just had an experience that like you've had in it.
Yeah.
I don't think you have a problem with Christianity. I think you have a problem with the experience you had, and I can understand because this is
now I do it. Now I accept that Christianity is technically where I get my fundamental.
No. I understand that, but I'm just trying to say like the reason like you said like you had an issue, not with Christianity itself. But I'm saying within like church and religion. Remember what I said before? I'm saying I don't think it stems from religion. I think the same way I was saying to you like about the people that are saying they keep telling you you're gonna go to hell. I feel like for you, your mom keep telling you go to this church, believe this, do this. It's your kind of thing where it's like Do you get it? Like like when you're just being reached with bad negativity, like why would you like the concept as a whole? From you think why does this exist? Like you man are stressing me, fam.
I think I guess majority. I think that 95% of it is that. The other 5% is just kind of seen in general how it causes divide, though. Do you get it?
Yeah, I know.
Because at the end of the day, it still does, and I still see. But 95% of it.
I was talking to my girl about this the other day, bro. This is one thing I feel like religion causes divide between the same religion, between different religions.
Yeah, everyone.
But this is what I never understood. You see the people that want to come and like, if I tell you, you shouldn't be doing this, yeah? Like, when we went to church, they say you should do this. That's me like saying, okay, like, do better. If you don't, I won't ask you if you want my help. If you want my help, I will not speak again, bro, because it's your life. But I'm saying there's people that like, instead of saying that, like, they'll come and say, you're going to hell. Like, why not doing this? Why not doing that? You didn't come to church this week. Like, you know what's going to happen now. But what I don't understand, yeah, is the whole belief system of Christianity, yeah, is heaven and hell, right? So if you're doing the wrong thing, God will judge you, fam. You'll get your outcome. Why do I need to police you, fam?
Yeah.
It's not like what I believe is like if you do the wrong thing, yeah, you'll end up in the wrong place. But then that's your punishment. It's not my job to punish you, bro. It's like if you park your car illegally and I'm not your friend, I'm not gonna be saying why you parking there, you can't park there. The ticket man will come and deal with you. I don't need to fight you, bro. That's one thing. You see, I said it causes divide. I feel like that's the main reason it causes divide. But I don't understand why people are so pressed by the actions of others. Like, do you know what I mean? Like I told you, bro, I've got bare friends that are Muslim here. I've never told them that they're wrong.
Yeah, same.
And look, do you know what the thing is? I'm not there to tell them that they're wrong because what I believe here is what I believe. It's not.
It's my gamble at the end of the day,
bro. It's not. It's like my interpretation of like what is correct.
Yeah.
So if your interpretation is different, it's fine. Like, bro, let me put it this way. If you told me like, I don't know, bro. I feel like a big cat came here and just burped and the earth became one, yeah. Bro, even though, like, of course, that's objectively nonsense, yeah? But if that's what you say you want to believe and you want to build a religion around that, yeah? And, like, you want to recruit people and you want to believe that together. Who am I to tell you that you can't do that, bro? Like, that's your business, bro. Like, me, you can still be cool, like, do you know what I mean? Like, don't invite me and that, but, you know what I mean? Like, but that's what I'm saying, like, it's not, I don't know, I'm not, like, me personally, I'm not that pressed about other people, bro.
Yeah, first.
Like, for me to, like, kind of care about what you think, I need to, first of all, like, respect your opinion bare. But if I don't, then it's blessed. Like in the same way, like I don't really feel like people respect my opinion that much on things I'm not that versed in. For example, like something I do for my job, fair enough, you can respect my opinion because I do know a lot about that. But other things, other aspects of life, like I don't know. If you ask me about like meditation or swimming or basketball, who am I to give you advice, bro? Like,
you don't know.
My opinion is worth what your opinion is worth.
Yeah,
so at the end of the day, when I finish talking, you want to shut up and do what you want to do. I can't sit and tell you you're wrong.
That's true, still. Yeah, man. I'm gonna take that with me, though. And just.
If you want to come to English Martyrs, bro, I'm there, fam.
No, I'll take it with me, bro. I'll take it with me. And I think it has kind of made me want to start, like, at least reading again and just get a bit more in tune, bro. Because I also got friends around me, too, that are, like, Christians and they go to church or they practice, they do this, they do that. And I see how much it benefits them. I just haven't found that healthy balance of it yet, innit?
No, I hear it, bro. But the balance is everything, don't it? So it's literally them ones there. Like I can't tell you what yours is. It might be different than mine. You just do what makes you like feel better to whatever extent that does. If that's for you to go church once every 2 weeks, if that's for you to go church once every month, if that's for you to not go church and say you want to be a different religion, that's on you, bro. That's on you. Do you get? I'm not here to tell you like you must come to my church, yeah, and you must be happy.
I hear it still.
Like, it's calm, bro. Like
I hear it still. Fairs, man. Yeah, I reckon we'll wrap it there, bro.
Come then.
Key pointers that I took from that is what? Be more organised, be more structured, and just go to church, man. But yeah, bro, I appreciate it still.
don't sound like a bad life, bro.
Yeah, you know what I'm saying? No, I appreciate you coming on, bro.
Calm, bro.